Pound this thing like never been pounded before.
Oh, that's not what I was doing.
All right. Welcome. Good evening. Welcome to the West Ada School Board meeting on August 24th. First of all, let's say welcome, everybody. I think this is the largest meeting in history, so good to have you. The last couple meetings, we've had a few more people and have challenged them to say the Pledge of Allegiance as loud as possible. So for the first thing we always do is stand and do the Pledge of Allegiance. The flag's over here, and challenge given. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, so first thing that we're going to do, because we just need to get it out of the way, is we're going to do our consent agenda, and then I'm going to walk you guys through what's going to happen this evening. So with that, I would open up to members of the board for a motion on the consent agenda.
Madam Chair, I move that we approve the consent agenda.
Thank you. Is there a second?
I would second.
Thank you. It's been moved and seconded that we accept the consent agenda. Is there any discussion? I'm going to make one discussion item. We are approving the ESSER funding in this consent agenda, which has a huge math initiative in it that Dr. Bubb has put together for this district to improve our students' math scores. So if you guys didn't know that was in that consent agenda, you now do, because it's a really big thing. So with that, we will vote. And just for trustees, tonight is actually one of those nights where I do need you to raise your hand, because we don't have, it's harder to see. So for all those in favor, please say aye and raise your hand.
Aye.
Aye.
Chair votes aye. Motion carries 5-0. All right. So I'm going to walk us through the evening here tonight a little bit, and then we're going to get started. So, and we have a couple guests with us online, so we'll bring them in here in a sec. So the first thing that I wanted to make sure everybody knows, because this board has met, we've talked about it, the superintendent, the administration, there is one North Star for this district. And that North Star for us is to keep our kids learning in person in school 5 days this year. That's what drives our decisions and everything we do, and that is the number one thing that we will do and work towards over everything else. That's our priority. We believe and hope that's your priority too. The second thing is tonight is that we have some meeting goals for tonight. So our goal in having this board meeting was to have a board discussion with the administration, with the medical community, with our patrons on the COVID protocols. And then if needed, make a decision for how to start the school year regarding COVID protocols. Where we're at today is our current policy says that Dr. Bubb here can make a decision on how a school COVID protocols exist. We have some standards around the health protocols around quarantines. And then we also have, he has the ability to require masks, to move a school, a classroom, or the district into a hybrid status, or a school, a classroom, or the district into a remote status. That's the current policy as it stands. So, I think we have some considerations that we want to make sure everybody's aware of as we had the discussion tonight. The first thing is we're in a constantly changing environment. The one thing that we've learned about COVID is that the only thing you can count on is that things are going to change. The board and Dr. Bubb, we've been very intentional about continually discussing flexibility as a component of being ready for this next year. And there really is no absolutes or promises that have been made or can be made in the current environment of COVID. We just can't. We will continue, though, to collectively assess situations and issues, and then come up and the decisions will be made and guided by our North Star, and that's to keep kids in school learning 5 days a week. The second consideration is that the board has a statutory responsibility. And I want to put that up because I don't know that everybody has ever seen this and understands what the board's legal duties are when it comes to managing infectious diseases. So I'm going to read the Idaho Code. And this is Idaho Code section 33512. It's section 7. There's like 19 things in this section, but this is the one specifically. So the board has a legal duty to exclude from school pupils with contagious or infectious diseases who are diagnosed or suspected as having contagious and infectious disease, and those who are not immune or have been expressed to a contagious or infectious disease, and to close schools if the board determines that conditions warrant such closure based on consultation with the district health department of the public health district in which the school district is located. That's our responsibility, that we're legally required to do that. There's two examples, I'm just gonna give two examples of where we've done that prior to COVID, just because we've done this in multiple ways. We've been implementing this duty prior to COVID, in some optional ways and some not so optional ways. So let me give two examples. The first one is a vaccine example. Every one of you has kids in the school district, knows we have a student handbook. In that student handbook, there is a section around vaccines. And in there, that section gives optional options for vaccine or not to have vaccines. What it also says, though, is that if we have a contagious disease or outbreak, and if there is a child in our school that isn't vaccinated, that we will have to remove that child from the school. That's an example of where we have an optional and a non-optional policy, and that's been around for a long time based on this law. The second is a flu example, and this is an operational example too. When we have a certain percentage of our student body out for the flu, we have protocols in place to close the school and to take preventative measures to slow and stop the spread. I just want everybody to understand that this COVID, how we've reacted to COVID, isn't new. It's just what we have has had policies in place to do some different things. Listen, you guys, I can get to the next piece of this really quickly because this meeting, I'll get to that in a minute, please. So listen, we want to acknowledge input from our community. This is the third consideration tonight. So we want to acknowledge there are people not in this room, those outside, those who've sent comments online, and anyone else who has reached out in the last few weeks. We just want to say thank you. We also appreciate and want to thank you for giving up your evening tonight to join us for this discussion. It's important for all those watching online and outside and reviewing later, and for all those in the room to know that the patron feedback that this board considers, we consider everything. So it's not just what happens in this room tonight. It's all the emails, all the phone calls, all the conversations that have happened prior to tonight as well as tonight. It's all considered by the board. Sometimes folks think that just because the one voice in the room represents the room or if somebody wasn't in the room that their voice isn't represented. That's not true, and we can assure you that every email, every comment, every consideration has been read by this board unless something came in since we started the meeting, and also by the superintendent. It is hard to respond to everyone, but we do read everything. So let's talk about the ground rules for tonight, because the ground rules are really important. Every person needs to be able to share their view without fear or intimidation. So what does that mean? That means, and I let it go for now, but we have to follow these from here forward. There's no cheering, no booing, no clapping, no heckling, no negativity towards others, no threatening of others, no personal attacks, clear, concise. We're going to ask folks to honor the time limit that we have so we can hear from as many people as possible. And one is kindness matters. We've been looking into how do we get to where you can show your support without how to stay within these ground rules. The discussion and the conversation needs to be conducted with the audience quiet, but we understand that you may want to show your support. So we have a solution that's been used in other school board meetings around the country. To show your support tonight without causing any disruption, when a speaker is speaking, please stand quietly as a sign of support for that speaker, and the board will see those who agree. So it actually is video on YouTube if y'all want to see it. It looks really cool. So what will happen if order can't be maintained at this level? Because I want everybody to know what will happen. If decorum is broken, I'll give one warning, and then if decorum is broken a second time, the board will recess. We'll resume the meeting online. We'll announce a break at that time and start back up at the time we're going to start back up, and public comment won't be available in the online meeting section. We are all role models of our school community, and right now we have to be intentional about modeling good behavior at all times for our kids. This country was founded on individuals who respected decorum, process, and another person's right to their opinion, and we need everyone in the room to do the same. We appreciate your help, your time being here tonight, and look forward to having a conversation with you. I do want to say one other thing. We are, some of us, wearing masks. Please do not take that as a sign of where we stand on this issue. We are all wearing this. I think I can finish this. We are wearing them because right now we have a policy recommending masks in our school buildings, and we are modeling good behavior by following our own recommendation. I don't want to issue the warning yet. Please help me with that. Thank you. So let's, because we know we won't get everybody to testify tonight, I have some questions for the audience, and I'd like you guys to do this through a show of hands so that the board can see what we have as far as who's in the room with us. So the first question is, if you would do through a show of hands, how many parents of kids in our schools are here tonight? Thank you. How many are elementary parents? How many are middle school parents? How many are high school parents? How many are patrons of West Ada but not parents? Grandparents can count as parents too. Sorry, parents or guardians. I should have said that. Thank you. Yeah. How many are patrons of West Ada but not parents? How many are teachers or administration in the West Ada School District? Thank you. How many are not patrons or parents or teachers or administration? So looking for folks in that vote. So you're not part of West Ada at all? Oh, okay. Okay. Thank you. The next question is a little bit around how long you've been connected to West Ada. So for those of you that aren't or from another area, this will probably not apply to you. But how many of you have lived or been connected to West Ada School District longer than 10 years? How many of you have done that 5 to 10 years? And how many less than 5 years? How many less than 2? Thank you. All right, now for the big questions, right? How many of you support masks required? Thank you. How many of you support masks optional? Thank you. So, and we asked that last question for a very important reason. If you don't get to testify tonight, we did see where the hands were at in the room. We have some folks. That's true, but we don't have all the time, so that's why I want to make sure at least you got that one piece out. We do have some folks who represent parent groups in the room, and we're going to ask those leaders to identify themselves right now. If you guys could come up to the mic and let us know which group you represent and who you are, that would be much appreciated.
My name is David Benetti, and I represent the West Ada Parents Association.
Okay, thank you, David. Are there any other groups represented tonight? Thank you, come on up. Both of you can come on up, so.
My name is Shiloh Evans, and I'm here to represent the community, the West Ada community for health and safety.
Thank you.
Hello, good evening. My name is Jared Lucas. I'm representing 3,800 parents that are part of Rally for West Ada.
Thank you. All right. With that, I think, did I catch everything? All right. And we're going to use that information later when we get to the public comment piece. So I wanted to just make sure we knew who we had represented in the room. Oh, I did have one other question. Is there any leaders of the union represented in the room? Thank you. Mr. Perez, is that, I don't have my glasses on right now. Thank you. So, thank you. Okay. All right. So, Troy, are we ready with Dr. Oh, sorry, I have one other thing. So we're going to walk through, tonight we have Dr. Souza and Dr. Bramwell from St. Luke's Hospital joining us as our medical professionals. We're going to walk through, they're going to talk to us about what's happening from their perspective in the hospital community, as well as to give us some specific data and information. The board's going to ask some questions of those folks. Actually, for those parent group leaders that are here, we're going to, because we want to make sure our parent groups actually get at least one one question in. So we're going to ask, so Mr. Benetti, Ms. Evans, Mr. Lucas, and Mr. Perez, be ready because we're also going to give you an opportunity to ask one question of the medical professionals as well. And then after we go through that, the board will move to Dr. Bubb, who will give the boards a recommendation on some options and then some pros and cons on all of the options. Once that's complete, we'll go into the public comment section and we'll have a little bit more conversation before that starts. And then at the very end, the board will have some discussion and we'll see what happens after that. So with that, we'll turn it over to, I think we got him up there, Troy? I can't see. Oh, Dr. Souza and Dr. Bramwell, will you guys turn on your cameras for us? Thank you. Welcome to the West Ada School Board. Can you see us? Yeah. Biggest school board meeting you've ever been to?
Don't know. I can only see you, but
you can't see.
Sounds loud.
I think, let me describe for you. I think we have about 300 to 400 people in the room with us tonight. So, well, we appreciate your time. I think, and really appreciate all that you guys are doing for the community. There is a lot going on, and we know you've been dealing with this for a really long time. So with that, I think I'd just turn it over to you and let you guys kind of kick us off, if you don't mind.
Okay. Thank you, Amy. I think I'll make some opening comments and then turn it to Dr. Bramwell, who leads our children's hospital. By way of introduction, I'm Jim Souza. I'm largely serve in an administrative role at St. Luke's, and however, I still practice in my specialty, which is pulmonary and critical care, and I have practiced throughout the pandemic, including in our intensive care units. So that's my background. I wanted to share what's happening with hospital capacity, why that matters, and then pivot to what that has to do with kids. And then if you'd like, we're prepared to, offer recommendations. Dr. Bramwell is going to have more to say on those last two things. So to start with, what's happening with our hospital capacity for care. The truth is, we're in trouble and we're heading for some choppier waters. What I'm going to be sharing is St. Luke's data. We're the largest healthcare system in the state and have the most capacity. Before I do this, I want to be clear what I'm not talking about. I'm not talking about labor and delivery beds. I'm not talking about pediatric beds, and I'm certainly not counting, like neonatal ICU beds, which are little cribs actually. What I'll be talking about is the adult hospital bed capacity, because that's what's most relevant regarding COVID and its interaction with hospital capacity. So today, just before this meeting, I checked our census. We have 162 patients with COVID in our hospitals across the system. Okay, so that's across all of southern Idaho. For comparison, in our December surge, our peak was about 168. 44 of the 162 are in adult intensive care units. We got to that number over about 4 weeks. And what's different between this surge and the last one in December, January is it took us about 8 weeks to get to that number in December. When I'm asked about our hospital capacity for care, people always want to know things like how many beds do you have or how many staff beds do you have? And what I can tell you is the way I always answer that is it depends on when you're asking. Are you asking me right now? Are you asking me 4 hours from now? Or are you going to ask me tomorrow morning? We admit 150 patients a day, and then we discharge 145, and then we admit 160, and we discharge 155. And it is this constantly churning and shifting kind of Jenga game of managing capacity. For example, in Boise, because of this surge in activity, We recently, last week, closed our cardiac observation unit and we turned it into an overflow ICU. On Friday night, we had 5 patients in there. By Saturday morning, it was down to 2. And because a couple of patients in the regular ICUs got better and because we had 2 patients die, we moved those patients in that observation unit on Saturday morning back into the regular unit. And by Saturday at 6 p.m., we had 5 more patients in there again. In that same unit, yesterday we had 5 patients, then it came down to just a few overnight. Today it's back up to 7. And then today we're actually opening additional ICU bed capacity on an adjacent unit called 3 telemetry. Here's the point. Today, 4 out of 10 of our hospital admissions in adults are people who are sick with COVID. So 40% is the number. If you look at all of our adult admissions, 40% of them have COVID. And when you look at our ICU, more than 70% of all of the patients in our ICUs have COVID, with more than half of them on mechanical ventilation, so heavy cares. Their average age in the ICU is 54 years. 95% are unvaccinated. A few of them have been in the hospital since June. Over the past 5 days, we've had 8 additional people die from COVID. Last night, we actually had 4 deaths. Their ages were 70, 60, 52, and 40 years. Our average death rate is the same as our average ICU age. It's 54 years. Our data this morning wasn't updated to account for the 4 overnight deaths, but we've had 25 deaths from COVID in August so far. What are we doing to manage? We've moved our nursing ratios on our floors and contemplated that in our ICUs. Haven't had to go there in our ICUs yet. Our wait times to even get back from a waiting room in the ED have soared. We're boarding patients in the ED now for many hours, which is an unusual thing in Idaho. We have, you probably are aware, canceled elective cases. That means a person diagnosed with curable colon cancer 2 weeks ago is being told they need to wait to get that thing out. We've opened new units, as I've already shared. We've opened up all kinds of incentive pay programs. We've activated our physician surge plans, and we are actively pulling doctors out of clinic now to help staff hospital units. For each of the last 2 weekends, we've activated our ICU doctor surge plan, and we've pulled doctors in from needed time away. We're considering weekday activation of our intensive care specialists now. We are also creating plans to move non-critical patients from Boise, Meridian, and Nampa out to critical access hospitals that might have med-surg beds, because we're progressively turning our acute care hospitals into intensive care units. So what that means is we're contemplating how we would manage an elderly patient who falls and is seen in the Meridian emergency department, and we don't have capacity there, so we transport them to Jerome, Idaho, or to Mountain Home, Idaho, to be cared for. The bottom line is that the high quality of care that I think we're all used to has already eroded significantly. I would say that what we're providing today is substantially less than the standards we'd expect, but it is the best we can do, and we're headed in the wrong direction. Now, why is this important to all of us? The answer to that is because we all need hospitals, sort of like the police or the fire department, except different from the police and the fire department, where sometimes some of us will need them. I mean, literally everybody I know is going to need a hospital sometime. We just don't know when. I'd also remind folks that hospitals take care of all kinds of people with acute illness, and those have not gone away. You name it, cancers, infections, trauma, bowel problems, lung problems, heart attacks, strokes, arrhythmias, intoxications, withdrawals, mental health disorders, all of it. Those have always been there. And in fact, in the spring and summer of this year, they've been higher than normal because of the pent-up demand from the previous COVID surges. Now, think about that and then apply the fact that currently 40% of all of our beds are occupied by COVID patients and 70% of our ICU beds are occupied by COVID patients. So we still got to provide all that other care, but now we can only provide it with 60% of our med-surg beds, or worse, 30% of our ICU beds. So the quality of care is as good as we can provide right now, but we are no longer operating in community standards of care. That probably means something to legal folks in the room. We are clearly operating in contingency standards and doing the best we can. And unless there's a change in the trajectory, and unfortunately, all the signs are saying we're not seeing a change coming immediately, this current situation will probably get worse. We can look at other states around the country to see what it might look like, and we will probably find ourselves moving to crisis standards of care soon. If you would like, during Q&A, I can describe what that is, but I thought for this conversation, that's probably not important, and that's where we're at. The thing that's different this time is that we don't know where the end is, and all of the signs are bad. The rate of rise of this variant, because it's so infectious, has been pretty amazing. And the other thing that's troubling is pretty much all of the mitigation that we had in place to protect us in December and January is gone. I mean, just look around. It's gone. So I'm going to pivot quickly here to what does this have to do with kids? I'm going to say something briefly, and I want Dr. Bramwell to weigh in, and then I do want to ask if you want recommendations. The issue with kids, fortunately for the kids, is not a lot of hospitalizations for kids. But let's just talk about that for just a second. Last year, my understanding is that this district had about 1,500 cases amongst your 40,000 or so with masks. Knowing the increased infectivity of Delta, as we do, you can expect significantly more cases. And from those, you can expect not many, but a few hospitalizations. I don't know their names yet. I only know that we will know their names in the months ahead. It'll probably be a small number, probably less than 20. And that's if nothing has changed with Delta. From the southeastern US, we're not sure that's the case, since children's hospitals have been pushed beyond their capacity already. So we are worried. I think it's also important to know in the United States and here in our community, children's hospitals in general haven't been built with a lot of capacity for care. So we have exactly 12 pediatric intensive care unit beds in the state of Idaho, and they are in the brick building off of Bannock Street. The real point for the kids is not that a bunch of kids are going to get terribly sick, fortunately. The real point is that the kids have parents and the parents have parents. So the kids are the reservoir that drive the hospitalizations and the eroded capacity, which we should all care about. So bottom line, we're all in it together. And my last point on we're in it together, maybe relative to kids, is that by the end of June in this country, almost 40,000 children under the age of 18 had lost a parent to COVID. Now, that was before Delta was fully entrenched the way it is now. We don't know what the end of that story is going to look like, but I do know it's an untold story that's going to leave a really large impact on this generation. I'm prepared to make recommendations, but I do want to let Dr. Bramwell weigh in on the pediatric factor and the connection with kids.
Thanks, Dr. Souza. I want to paint the picture of what we have here locally. There are a couple of things I wanted to add to Dr. Souza's comment. My background, again, I'm Dr. Kenny Bramwell. I'm an emergency physician. I still practice here at St. Luke's. I'll be at the Meridian Emergency Department this weekend if you want to come say hi. have primary responsibility as the system medical director for St. Luke's Children's Hospital, which is our 100-bed hospital on the Boise campus for children. We are the only and the largest children's hospital in Idaho. We are probably the most remote children's hospital in the country. We are 350 miles away from any other children's hospitals. The reason that's relevant is we have hit the situation a few times this summer where our children's hospital and our PICU have been completely full, and we've had to send patients to Seattle or Salt Lake City. And that's something that we loathe doing, but it does become necessary when we run out of room. We are at a point in the hospital and in the ED where we are running out of room routinely. When I was working last weekend in the Boise ED, I had a patient who waited for 3 hours with a dislocated shoulder in the front of the ER because we had no room to put him. We had no hallway to put him. He just sat out there and sadly kind of groaned for the 3 hours it took for us to get him into a room. Now, if you've lived in other cities, that's not such a big deal. But if you've lived here locally for a while, you are used to a level of care where that patient would get seen quickly and efficiently and nicely. We can't do those things right now. We are, in essence, begging you to help us stem the tide of this disease. It turns out that a lot of measures that worked last year don't work now. The amount of masking that we've become a bit lax on, the amount of large public gatherings that people are continuing to attend, spreads this illness in a way that I've never seen in my career. So in essence, we are begging you to help us as an enormous public institution with 40,000 students. In rough numbers, children represent 20% of the population in Idaho. They are about 10% of the cases of COVID in the last 18 months. They're about 1% of the hospitalizations and about 0.1% of the deaths. We have not had any deaths so far during COVID in our pediatric population, and we certainly hope that continues. The problem that we're seeing with COVID in other parts of the country is we're seeing about 3 times the number of hospitalizations that have been seen with other variants, which is why hospitals in Texas and other parts of the Southeast are overrun with patients, both general or adult hospitals as well as children's hospitals. I hear people commonly focus on the number of deaths as the most important focus and the most important statistic about COVID, and I would ask you to stop thinking merely about the deaths, because they are important, but what is far more important to me is the number of people who are walking wounded after having this illness. The number of people who for months at a time can't walk across a room, take a deep breath, or think clearly. I'd also like you to stop thinking about masks as being some sort of infringement on your rights or limitation of your freedom. Masks are inconvenient. I wear them for 10 hours at a time when I'm working in the emergency department. Madam Chair?
Troy, thank you. I'm going to ask again, and this is the warning now, for respect for everybody. If you don't agree, that's fine, stay seated. If you do agree, stand up. But for now, this is the warning. Thank you. Dr. Bramwell, please continue.
Yeah, what I was saying was to try not to think of masks as being some sort of sign of weakness or some sort of poison, but rather a way that we can help limit the disease spread. By far, our best weapon is the vaccine. In a large way, we were waiting for the vaccine through much of last year as a tool that we could use. We now have that, and as Dr. Souza pointed out, in many locations, including our own, more than 95% of the people who need to be admitted are not vaccinated. So this has become a critical problem for the unvaccinated more than other people. The other thing I'd like you to consider with school-aged children, that although they are not being admitted in droves, they are the most efficient way for diseases to spread through a community. You get influenza in a school, influenza will win because of all the little kids being close to each other, and they are very efficient spreaders of disease, even though they might not be sufferers of disease. And really what I'm asking you is to help us be able to help you as a community. The healthcare locations are hurting. We are outmanned and outgunned, and our best defense at this point is to continue masking in public settings. Thank you.
Amy, are you interested in a recommendation?
I'm going to wait for my mic here. Dr. Susan, Dr. Bramwell, before we go there, and I'm going to ask that question to the board, but before they go there, would you guys mind answering some questions from board members? So,
No, not at all.
No,
okay.
Don't mind.
So for board members, because we don't have lights, will you just raise your hand and let me know? So Trustee Kloppenstein.
Thank you very much. Appreciate this chance to be able to talk to you guys. Was curious, one of the things we keep seeing, especially with school districts in the South, is a variety of kind of ratios of kids who are sick versus kids who are having to be sent home. And I'm curious what you perceive as that ratio. Is it, I'm seeing it as high as 12-to-1, sometimes it seems 2 to 3-to-1. What do you think that kind of makes sense, especially for districts that are masked versus non-masked? Thank you.
Kenny, I'm going to let you take a crack at that one.
I'm not sure I'm entirely following the question. I will say that in way of response, that if everyone is masked in a school and there is a child who pops positive for COVID, that the other children in the class don't need to quarantine if they all were masked. But if they were not all masked, then there's a quarantine requirement from the CDC and from Central District Health, frankly, that the children who were exposed need to quarantine for 10 days. But it sounded like you were asking for a ratio. Could you help me understand that?
My apologies. Let me rephrase. One of the school districts, for instance, I believe it was Meridian, Arkansas, they saw 100 kids and that represented 1,200 quarantines. Whereas another school district, they saw roughly about the same number of kids who were sick, and they would see 400 or 500 quarantines. Are you familiar with at all, the number of quarantines versus, for districts that's masked or not masked, basically kids representing the number of quarantines that come out of a school district? I mean, do you have any idea about that, or anything it might be able to add? Thank you.
Yeah, the only thing I can think of is perhaps each school had, sometimes maybe these were primary kids rather than secondary kids, where a secondary exposure would sort of require 6 classes of kids going home versus 1. So you may have a different ratio there. You may also have some schools that will pod children, and they will respond to sicknesses in the pod as if they were a discrete class. Barring those 2 circumstances, it's hard for me to comment why the same number of sick kids would warrant disparate numbers of people quarantining.
Thank you. Is there any other questions? Trustee Kofelt.
Thank you, Madam Chair. Dr. Sousa, Dr. Bramwell, thank you very much for being here this evening. Just as a little background, I've spent 33 years in the fire service, and so we worked very closely with our healthcare providers, and so I respect you both, and I appreciate your spending time with us here this evening. But one of the things that I'm struggling with is when I was a fire chief and I made decisions, many times I was a part of the decision-making process for healthcare. I'm a school board member now, and my job is to make decisions that impact the kids and their learning. And what I struggle with is the picture you both paint is compelling. Why is it that our federal, state, and local healthcare agencies are not mandating a mask or something? I kind of feel like as a school board, we're being asked to mandate something on our children that our adults aren't being asked to do.
Thank you for modeling the good behavior. Appreciate it.
If I can answer that, Uh,
I appreciate it.
So the way that I would answer that is, I am afraid there has been a vacuum of leadership at many levels, and I apologize for that profusely. We are trying to do the best we can as local people who live here and work here and want to continue to provide outstanding medical care, and we're hampered in that ability because of the magnitude of this illness. The other thing that I will add is actually there are two organizations that are national in scope and focused on this illness. The first one is the Centers for Disease Control, or CDC, and the CDC has come out and said in the last 6 weeks, we believe that all kids should be in person in school, and we believe that all kids in person in school should be masked. The end. There wasn't any carve out, there weren't any exceptions. It didn't matter if you had had COVID, it didn't matter if you were immunized. The CDC said everybody should be in person and everybody should be masked. Teachers, staff, students. There's another national organization, the American Academy of Pediatrics, or AAP. They have also come out with essentially the same verbiage, that being in person is the best option for children. We learned that last year. We had some options, but they didn't ever work as well as being in person. And the only way to make that safe for everyone is to have every one of them masked. All students, all staff, all teachers. So those two organizations have responded here, similar to other disaster groups that you're citing as a fireman and a fire chief. But you're right, there are many other national organizations and state leaders who have skipped this issue and left it alone.
Yeah, I'd like to weigh in behind Dr. Bramwell on that. First of all, thank you for the kind comments and your work serving the public yourself. Yeah, there's been a lot of failed leadership. You know it when you see it. And you have my respect for whatever decision you make. Because at the end of the day, you know, you're going to have a few people thank you and a few people not be very nice to you. And it's going to be a leadership moment for you all in terms of the decision you have to make. And thank you for standing in when no one else provided you with any guidance. The second part of the color I wanted to provide is only to say, boy, you're not going to hear from me or Dr. Bramwell that if the West Ada School District takes any action, that it's going to save our bacon. Frankly, it would take the entire community working together in concert for that to occur. What we are saying, however, is that with your 40,000 students, you can make an impact. And that's just regarding our unique lens on this as healthcare providers. Again, I think I heard your opening comments about what your true north is. And maybe I'm gonna just pivot for a second. And well, actually, no, I said I would ask if you guys want our opinion. So I'm not gonna give it unless you ask for it. But it has something to do with your true north, not ours.
Thank you. Any follow-up?
No, thank you.
Okay. Trustee Buffy?
Thank you, Madam Chair. Dr. Sousa and Dr. Bramwell, thank you very much for being here tonight. I really appreciate it. I did have a clarification question regarding the projections about the 20 student hospitalizations. I believe you said that that was based on West Ada's 2021 school year data, and that was based on us being hybrid at some points and masked. So do you, if that's correct, do you have any projections of what our data would look like if we did 5 days a week of in-person instruction with mask optional?
I think if you did 5 days a week of instruction with mask optional, I'm going to say, as a parent myself, what your children will be subjected to is there will be peer pressure. There will be bullying, either for bullying of people who don't have a face mask or bullying of people who do. We all know kids, right? I mean, you don't want to be the one who stands out. So I think if it's masks optional, knowing that masks are a hassle, more children will take the option to not wear the mask, that the peer pressure will lead to even those children who leave home with a parent's guidance to wear a mask will take it off. And I think you will have an outbreak pretty quickly in your school year that interrupts your true north.
Follow up?
Not a follow-up.
That is at this moment in time. That is at this moment in time because the infection is out of control in the community. That could be a totally different story in 3 or 4 weeks.
I'll add to the question that, you know, the more that the kids are in school, the more likely this is to spread. The more flexibility you give, I keep calling them patients, children, the more flexibility you give children and teachers, the less masks will be worn, or the fewer masks will be worn. And unfortunately, the current virus has shown itself to be about, between 2.5 times more infectious. And so most states are seeing a tripling of their prior admission rates. So if you had 1,500 last year, I would expect at a minimum that it would triple, but I would also expect that it would go up because you're spending more days together, and that it would go up again because of masks being optional. If I can add one other thing, I'll ask you to remember what happened in the spring when, in essence, the CDC made masks optional for the public. When the CDC said, hey, if you've been vaccinated, you can take your masks off in most settings. And if you haven't been vaccinated, you shouldn't take your masks off yet in most settings. What happened at that point is the people who didn't want to get vaccinated or wear masks didn't do either of them. And the people who had gotten vaccinated and didn't mind wearing masks largely stopped wearing them a lot. In essence, the masks just went away. If you paid really close attention back in May and June, you'll still see some people in some communities wearing a mask, but not many.
Thank you. Any other follow-up?
Not a follow-up, but another question.
Oh, go ahead.
So I've received some feedback from parents talking about negative medical impacts mask wearing has caused their children, such as migraines, anxiety, allergies. Is there any medical evidence that mask wearing causes these issues or leads to a weakened immune system?
I'm going to leave that to my pediatrician friends.
Well, I will say that there are no credible studies that have shown consequences of wearing masks. I will also add that masks have been shown to be incredibly effective at preventing illness. Let me share a brief anecdote with you. Usually, the reason that we are busting at the seams and have a very tough winter every respiratory season is because of a few viruses. RSV is one, and influenza is another. Those are usually spread very effectively and efficiently between people, and they fill up our pediatric or children's hospital every year. This last year, when people were quite diligent about masking and spacing and all the other things out of caution, we didn't see a single case of RSV in our children's hospital nor in our clinics for almost 8 months. So it's shocking how many diseases were stopped by these masks. There were no cases of RSV and no cases of influenza, and those viruses usually bring the children's hospital to its knees, and it just did not happen.
Thank you. Follow-up, Trustee Buffy?
One more, please.
You're good. This is to make sure you have all the information you need to make a good decision, so.
Thank you. Okay, so another common theme is related to social and emotional impact that masks have on students. So would you please speak to that, and if possible, compare the risks to not masking?
Go ahead, Ken. You go first. I do have one comment that'll probably add a little color.
You know, I would categorize masks as a nuisance. I don't like wearing them. I get these horrible sort of calluses behind my ears because the straps are under pressure and I have a big head, and it's unpleasant. I would rather not wear a mask. It's just the situation where we find ourselves currently and sort of the rules in my place of business. I think that there have been profound problems in the last 18 months with our children and their psychiatric disease burden. The number of patients who have been admitted to our children's hospital with severe anxiety and depression has quadrupled. The number of patients who try to take their own life with pills or something else has also quadrupled. It has been far more of a problem of a psychiatric nature than of a respiratory nature. But I don't think, and to be completely transparent and honest with you, I don't think we know what is causing this, but we blame it more on the isolation than we do on the masking. We have not seen masking cause this level of psychiatric illness or an uptick in anxiety in other folks who have had to wear masks. So we feel, and my pediatric psychiatrist, I believe, would confirm this, that the isolation and the difficulty and the anxiety and other problems that we are all having have spilled over into children. But I wouldn't blame those issues on the masking. I would blame them more on the isolation and the anxiety and the difficulties we're all having. But to be completely honest, I do not have data about what's causing what, other than there has been an enormous uptick in psychiatric illness.
I'd only add this color that our young people are amazing and resilient, and that in not in your public school setting, but in other school settings, the topic of uniforms comes up all the time, and other rules in different schools. Our children do well with order. They can struggle when there's chaos, and with respect, I think if we adults were able to communicate with them in a more coherent and consistent way about, pick the topic, but masks is the topic, I guess, at the moment. I have a high degree of confidence that the overwhelming majority of children would do really fine with that. And the alternative is what concerns me more. Making it masks optional and allowing the shenanigans that will happen because of that, even bullying, which everybody wants to avoid.
Thank you. Any other questions?
Thank you.
Trustee Ozuna.
I have a couple questions, and then I am interested in your recommendation when it's time. My first question is, what is the latest on the vaccine status for kids under 12?
That's a great question. We have received word this week that the Pfizer vaccine has been transitioned from EUA, or emergency use authorization, to full FDA approval. Your question is about children under the age of 12. We are waiting with bated breath for the next phase of that release. I am hopeful that it will be in the next month, but we honestly do not know. It could be as long as 3 months. I have not heard anybody make a guess as to when the next age bracket will be released or approved by the FDA, presumably under EUA initially, in an effort to get it out quickly. So the short answer is we don't know, and we hope it's very soon.
Thank you for that. My second question, if we can't get full mask compliance through a mandate or through other measures, does some compliance help in our schools?
I think relative to your true north, it's not going to save you at this moment. I'm going to keep coming back to at this moment, given the degree of spread. This as Dr. Bramwell has pointed out, is so much more contagious. The rate of rise blowing us away. That yeah, if you can't get everybody to work together, it's going to find all of the pockets of non-immunity. I think the story with COVID is the Delta variant is either you've got immunity, you've acquired it through infection, you've acquired it with a vaccine, or Delta is going to find you. Unless you live in a cabin on a hill with no running water, it's going to find you.
Thank you. I do appreciate both of you being here tonight and everything that you're doing to serve our community. And Madam Chair, when I would like to hear the recommendation when you think it's time.
Okay, thank you. Before I ask any questions, I want to make sure if there's any follow-up from board members. Dr. Souza, Dr. Bramwell, I just have one question for you. I think everybody covered some things I had written up. One of and I think Trustee Ozuna started it, and I want to just kind of come back to it for a minute. One of the challenges that we have, right, our true North Star is keeping kids in school learning 5 days a week. And part of that is that they have to have good family support to do that. And so this situation puts, sometimes, depending on how we create a policy, can create problems in the family support. And so, and maybe this, I don't know if there's going to be an answer to this or not, but one of the challenges we've always had throughout COVID right now, and I'm saying always, is that sometimes our educational priorities and our medical priorities don't necessarily exactly align. And we have in the past picked our educational priorities over the medical priorities and been okay so far. So I'm going to follow up on Trustee Ozuna's comment and ask a question about K through 6, because that's our biggest population of kids right now who cannot be vaccinated. If we had, I got two questions. One, if we had policy that affected just those kids, would that help, hurt, or make no difference in the situation? And then my second question is, if we had 80 or 90% compliance with masks, would that help, hurt, or make no difference in the situation?
So I would say, thank you for the questions first. Second of all, I would say anything you can do as a board to elevate the percentage of patients, I'm going to call them patients because I think everybody's going to get this illness. I'm sorry, but that's what it looks like. Anything that you can do to increase the compliance of masking in these young patients will be better. If that's a requirement based on age, if that's a recommendation only, I think anything that you do will help. I do think that there's a problem that you may not have considered directly, where if some of the kids are masked in a room and somebody has COVID in that room, if they're all masked, then quarantining is only based on symptoms. But if some of them are masked, then everybody needs to go home for 10 days. So that's a sort of shut down the class problem that happens with COVID that will in fact happen with this variant of COVID that you may want to consider. So back to your initial question, Madam Chair, I think that anything you can do to increase masking is helpful. And, you know, we would certainly, I think Jim's going to talk about our recommendations here shortly, but that's how I would phrase it, is anything we can do to increase masking is going to be helpful to mitigate against the spread of this virus.
Thank you. We did promise, we have a couple parent groups in the room. There's, well, there's actually 4 people here. So our union leader is one. We have Mr. David Benetti, who's our West Ada Parent Association leader. Shiloh Evans, who's our West Ada Community and Health and Safety parent group leader, and then Jared Lucas, Rally for West Ada. We did offer them all, and I believe they're all going to take it. Let me know if you're not. An opportunity to ask you guys one question each, if you don't mind, before we get to the recommendation. Thank you.
Sure thing.
I'll ask Mr. Benetti to come up first. Yeah.
Gentlemen, can you hear me?
Yes.
Wonderful.
Yep.
Thank you so much. So we appreciate your service. We understand that you are facing significant challenges. One of the major concerns of the West Ada Parents Association is that education is being sacrificed for our children, and some of the things you mentioned, social, emotional development, these things are extremely important to our children's development. And the bargain that we are supposedly being offered today is that if nobody gets mad, this, worn all the time, this mask that I'm holding up, and I'm not sure that you can see me, but I am holding up this mask that I bought at Target. This is going to guarantee that all of our children will remain in school 5 days a week through the end of the year. That is the bargain that we are being asked right now. Do you think that that is a reasonable assumption, that wearing masks all the time, including with 4-year-olds from paper masks from Target, is going to guarantee that we will never have to close the schools from now until the end of the year?
If you ever hear a doctor say guarantee, run, because there are no guarantees in this life, and almost nobody knows it as well as a healthcare professional who sees terrible things happen to good people every day. There are no guarantees. This virus is highly contagious. Mask is better than nothing. So it's a question of odds. And I think, you know, I'm going to talk when we get to our recommendations about the exercise of even overs. I think the weighty decision in front of the board is not choosing every priority, but actually going through the exercise of which one priority actually trumps all others, is at the top. And then once you agree on that, what are the things that you can do to increase the odds that you achieve that objective? Dr. Bramwell, would you like to take the guarantee bait?
Sure. I will guarantee that we don't know. I will guarantee you that right now, our masks, or the wearing of masks, is the best option we have before us. And the higher the percentage we can get of mask compliance, the better things will go. I am confident that the reason we only had 1,500 cases in the school district last year was because of the combination of all the mitigation measures that were occurring. Those are masks, those are hand washing, and those are environmental concerns, I will call them. So no, I certainly can't guarantee that the masks and the wearing of them will keep all of our kids in school, but I can say that right now, it's our best option.
Thank you for your answer. It would also be helpful, though you don't need to answer now because I only am afforded one question, but it would be extremely helpful for this board to know the 7-day rolling average of hospitalization rates for those under the age of 18 and vaccinated adults, as well as the mortality rates in Idaho, 7-day rolling average, hospitalization, and mortality rates. Those rates could be extremely useful as the board is formulating their decision, and I have looked for them earnestly, and while I can find ample information about positivity rates, rolling day average on hospitalization and mortality is wanting. Thank you for your time.
Thank you. Ms. Evans. And I know I probably didn't get the name of your organization exactly right, so I apologize for that.
Actually, you got it exactly
Okay,
right.
thank
West Data Community for Health and Safety. Our organization is concerned about the children as well as concerned about how it spreads around the community. And you had mentioned that there was a delay for a child who had a dislocated shoulder, a delay in his treatment. And if you were to move to the crisis standards of care, we wanted to know what kind of reasons might a family come to a hospital where they'll be surprised they won't get the treatment as they were expecting it?
I can try that one. Kenny, I'm going to rephrase the question because I had a little bit of a hard time hearing it. What was the question, like, what does crisis standards of care look like? Something like that?
Sorry, I'm a bit nervous and I stumbled a bit on my words. If you go in for a dislocated shoulder and you've got pain, you're expecting to be taken care of almost immediately. If you move into crisis standards of care, then what other areas of illness or injury might parents bring their children, or the families themselves, the adults, where they'll be surprised that there is such a delay of treatment or that treatment's not the way they expected?
Yeah, maybe I'll make a comment. Dr. Bramwell is an emergency department physician too, and his comments might be apropos here. But crisis standards of care is something we've been talking about since the beginning of the pandemic that we never want to see implemented. The mechanism of administering crisis standards of care is it's unconscionable in the wealthiest nation in the world. Absolutely unconscionable, and it's never happened in Western medicine. If the hospital systems in the state have run through all their surge capacity, right? Done everything we can. So we've closed our ambulatory units, we've closed our operating rooms, we've redeployed those staff all to provide critical care. We've taken, patients who just need a hospital bed and moved them to Mountain Home or Jerome or McCall to critical access hospitals. If we've done all those things and we still can't manage the surge, we'll indicate to the state, and there's a plan, that we need to activate crisis standards of care. Once a crisis is declared, then we activate our plan, and our plan involves scoring people in the emergency department. So individual humans would receive a score based on their severity of illness that determines whether or not they qualify for not admission to the intensive care unit, but a trial of admission to the intensive care unit. And that means they're rescored at 72 hours. And if things are going in the wrong direction for them, and someone with a better score needs the bed, we would deallocate the resource. That is, as I said, unconscionable, never done in these United States, and would represent a complete and total failure of our ability to work together to prevent that from happening if it occurs. Thank you for the opportunity to describe that state that none of us ever wants to see. Kenny, what's the ED like in crisis standards?
In crisis standards of care, which I've not ever seen, I will tell you what we've had lately, which is not crisis standards of care. It's just where we have landed. I mentioned I may have said kid earlier. He was 30, so I call 30-year-olds kids sometimes. So it was not a child with a dislocated shoulder. What's happening right now, we had a child last week who had diabetic ketoacidosis, which is a life-threatening complication of diabetes. The pediatric ICU was full. The child spent 36 hours in the emergency department getting care as best as could be provided in an emergency department setting outside of the PICU. We routinely right now, when I go into the emergency department, we have a half dozen people who were technically admitted to the hospital overnight, but there aren't places to put those patients, so they wait on the emergency department, hoping that somebody will get discharged upstairs and that those patients will go upstairs later that day. That's how things are right now, which is why, if you think about it, whenever there's a problem in the hospital, that's reflected in the emergency department. So if the hospital ICU is full and you have an ICU patient, they stay in the emergency department until an ICU bed becomes available. Similarly, if you have pneumonia and you need to be admitted to a general medical bed, but there isn't a general medical bed, you stay in the emergency department. So what's happening right now, we call those patients boarders. We are having boarders almost all the time right now because the hospital is at or over capacity and we can't send patients upstairs. So when those patients stay, we can't get new patients moved to the emergency department and they wait in front of the emergency department inside the building, but in chairs in a waiting area. And it's sort of unpleasant and miserable and nobody likes that. And if you've lived here any period of time, you may not have seen that much. People in other cities see it all the time, which is why many of us choose to live and to practice here because we're able to provide such fantastic care. But that ability to provide fantastic care is impeded right now by the quantity of patients who have COVID who require inpatient resources.
Thank you.
Mr. Lucas, are you still, okay, thank you.
Esteemed doctors, thank you for being here. I'm not sure you can see us, but there are several hundred people here, and many of us have friends and family that are your colleagues at St. Luke's. I believe you're both from St. Luke's. Sorry if I'm wrong. And we just honor what our frontline workers like yourselves do and all of our friends and family do, and we appreciate that. And especially in light of last year, without a vaccine, the heroic efforts that our frontline workers were doing left a deep impression on my heart and all of us. And as we know many of your colleagues and we talk about them, and you have helped educate us today in a very detailed manner about the apparent catastrophic community health conditions, have you pondered the wisdom of the decision to require a vaccine for your staff, the same staff that last year served as heroes without a vaccine? And this has resulted in a 20% drop in experienced personnel, which partially is causing the capacity issues you are asking our children to fix.
Yeah, I can take that, Kenny. Thanks for the question. Of course, we've thought about that. It was a really hard decision. We're grateful that we now have the FDA authorization and hope that helps some of our people make the decision that we know is most likely to protect them. You heard the statistics I shared on the ages of our patients. Those are the same ages as our workers. We looked at this in the cool light of probabilities, and there were no guarantees. Long about mid-June, we saw the surge in Delta coming. Our sick call-offs were going up. Today, right now today, we have 250 of our employees out sick, with 150 of them confirmed COVID. We're the health system that actually had one of our providers die from COVID. We're a health system that has had numerous employees admitted with COVID. And we're a health system that has had, sadly, some of our best disabled by long COVID. Our even over is different than your even over. I think your even over is going to be keeping kids in school, but I'm not sure. I'm going to ask the question. Our even over is safety for patients and safety for staff. And then the cool light of probabilities and admitting freely vaccines have side effects. Vaccines are not 100% safe. But knowing that the choice our employees have is either the 1,000-fold lower risk of death from a vaccine or the 1,000-fold lower risk of myocarditis from a vaccine or the 1,000-fold lower risk of thrombosis from a vaccine contrasted with COVID replicating in their bodies, where you can walk through our units and see the mayhem of blood clots, see the mayhem of myocarditis. And I'm sorry you're getting me revved up on this. We made an even over decision that their safety had to come first and that acting in concert would cause more of them to hopefully grab onto this vaccine. We gave ourselves enough time for intensive conversations led by our physicians with them. I've been part of those. I listened to every single employee's legitimate concerns because they're all legitimate. I am the most happy and proud of the few individuals who I know for certain after I've spoken with them have gotten a vaccine because I actually think I might have saved their lives. Because it's hard to walk through a unit and see a person less than 20 years old, pregnant, paralyzed, and in the prone position fighting for her life. Thank you.
I'd just like to thank you for both coming. I know you're doing this of your own free will, and we appreciate listening to your opinions. Thank you.
Thank you.
Thank you, Dr. Bramwell and Dr. Souza. I really appreciate your honesty and all you've had to deal. That was a tough answer, I know. We have one last question. This is from Mr. Sam Perez. He's our union leader for West Ada School District.
Thank you, everyone, for being here in this difficult time and place where none of us want to be here dealing with this. And I also agree we're being left to decide the fate of our jobs, our children, while other leaders get to slide by. Our wonderful community here represent a lot of children. So with that being said, I've had question after question after question from staff members. And one that comes to play, there have been others that have been asked that I was going to ask, but this is the last one from a number of teachers, and that you were so passionately explaining how the hospitals are requiring vaccinations. So, since so many other vaccinations are required for students to attend school, as according to Title 33, with very rare and few exceptions, would you require eligible students and staff to get the vaccine? And if so, how would that mitigate the spread and us going back to a normal school year once and for all? How would that help? Thank you.
I'll try and answer that. I think there were a few questions in there, Sam. I will share with you that I'm a big believer in vaccines. Vaccines have changed the approach that we take to small children with very high fevers. Vaccines have changed the way we approach many people with chronic and suddenly acute illnesses. I will say that in the last 100 years, every disease that we have cured or taken out of the center of public life has been through a vaccine. Polio, hepatitis, tetanus, which I saw once and I hope to never see again, diphtheria, all of these diseases have gone away through vaccination. There is no disease that has gone away through natural immunity. So I am a big believer in vaccines as a mechanism for public health. I think you asked if I would require this of students. I believe that we could treat this vaccine the same way we treat many other vaccines, where students need to either get the vaccine or a waiver or a rationale as to why they do not get the vaccine. I don't see any reason why this couldn't land in the same way that the meningococcus vaccine is, for example, or the DTaP, the diphtheria, tetanus, and acellular pertussis lands. I would put this in that same category of vaccinations that I would like to see as many people as possible get, recognizing that there are legitimate side effects that happen with these. But as Dr. Souza pointed out, in the setting of COVID, take, for example, myocarditis. It happens in about 18 out of a million adults who get a COVID vaccine, and it happens in about 50 teenagers or 12 to 18-year-olds who get the vaccine. So there certainly are some risks. But like Dr. Souza mentioned, the risk of getting myocarditis from a wild type infection is about 1,000 times higher. So in essence, I believe that what we have done is made a very calculated decision that we thought the vaccine was the best option for the most people.
Thank you both. One of the things that we really wanted to do tonight when having you here was to have a good, honest discussion with our medical professionals. And I think I'm going to speak for the board in saying we believe you have provided us with a lot of honest answers, and we appreciate that. What I think we do now is listen to your recommendation as has been asked for.
Okay, thanks. And Kenny, feel free to embellish this if I get it wrong. I did suggest this exercise of even overs, and I wanted to explain that. I think obviously we'd all like to have it all the time, right? And thinking about your decision, I probably haven't contemplated all of the factors that weigh in, but I'll just name some of them. You know, keeping kids in school continuously, keeping kids safe, keeping teachers safe, keeping everyone happy, protecting individual choices. So, you know, those are maybe not all of the hard things that you're weighing tonight, but I thought it was maybe a partial list. I would suggest that many times in this life, we can't have it all. And this exercise of forcing yourself to do an even over is not easy, but it can be clarifying. So, in other words, of those priorities, keeping kids in school continuously, keeping kids safe, keeping teachers safe, keeping parents happy, protecting individual freedoms, what is your even over? So which of those, if you had to prioritize, because I'm afraid you do, would you prioritize even over the others? If it's keeping kids in school, as I think I've heard you say, continuously and uninterrupted, then Dr. Bramwell and I don't think you need to look any further than the other states around the US that are out ahead of us to inform our decisions. I also think you maybe don't even need to look beyond Ada County. There have been local examples in the non-public school space right here. Schools and entire cities have been shut down, sometimes within days, due to surges in this Delta variant, coupled with their, unsustainable strain on their local healthcare systems. So if the most important goal, even over everything else, is to keep kids in school uninterrupted for in-person instruction, our recommendation would be pretty clear, and I'm going to do this thing again at this time. Start school with a mask requirement for all staff and students. But quickly, I want to say this, commit that this is a short-term play. Perhaps only weeks in length. Commit to return to that decision at that time, and commit to all the parents in the room to move away from the requirement as soon as possible once the current surge is back under control. It's hard to say how long that will be, but I can tell you by looking at other states like Missouri, which was kind of first to go in this surge of Delta in this country, that it literally could be weeks, a few weeks from now when you're able to make a different decision. But that is if that is even over everything else your number one priority. We believe that gives you the greatest odds of achieving that goal. If making everyone happy or if individual freedom trumps that goal, then the cards will fall in a different way, we think. Would you add anything?
Yeah, I would just add an apology that you folks are being left to make this decision. It's unfortunate that the school boards, both your board and other boards, are being asked to make a decision about public policy that could have been made at a state or a federal level. I feel for you for that. I will tell you that anyone who will listen has heard this same message from Jim and from me, that we think that masking is the best option currently, given the infectivity of the virus. I would like to see this same masking rule in other places, not just in schools, but the other folks haven't approached this yet. So, like I said, this is unfortunate. This falls on your shoulders to determine what happens for 40,000 children, as it could have been decided elsewhere. But thank you for listening so intently to us.
Thank you very much. I'm going to open it up. Just want to make sure anybody on the board wanted to say anything else for the doctors before. We really appreciate your time, your commitment, your service. I will probably not do it very well to how much we appreciate you both. We've got some more things to come tonight. We will definitely, as you allow us to, check back in with you. So thank you very much, and we'll see you guys later. Thank you.
Thank you, and good luck in your deliberations. And if we can help in any other way, we'd be happy to at any time in the future. Thank you.
Thank you very much.
Thank you.
We're going to take a quick break. Before we do that, though, I wanted to let folks know in the audience, as Dr. Souza described the even over discussion, when we get to the public comment period, we would like to hear from you what your even over is. So as you're thinking through that now, and he gave some good categories, that is one of the things that we would like to hear from you in the public comment section. So we're going to take about a 10-minute break, and we'll be back from there to hear from Dr. Bubb.
Wow. Yeah, thank you. Nice to meet you. Let me come around.
Thank you. And I'm going to do this as much as I possibly can. I want to just show appreciation for folks doing exactly, showing their support in the ways that we asked. It keeps the meeting going, and we really appreciate you helping us along. I also want to say thanks to the folks who kindly came up and expressed a different opinion to us, and that's what we want. This is a conversation. That's the value here, is when we can all have a conversation. Now I'm going to have to say something that probably isn't going to be super excited, but this is just breaking news. Caldwell School District just decided to go mask required for 3 of their schools because their schools met the 10% limit of their students being out in absences. So we are starting to see some changes in even our current schools who are open, and I wanted to make sure that information was available. Now we have Dr. Bubb. You're up with a set of COVID recommendations, our COVID-19 safe return to school recommendations. So, before I forget, sorry. Sarah Hatfield, are you in the room? I don't see her. We have a cell phone here for Sarah Hatfield, so if she's listening online, we'll have it, and we'll have it at the front desk tomorrow if she's not here anymore. So, all right, Dr. Bubb, sorry, want to make sure somebody got their cell phone back if I could. The floor is yours.
Let me start with just my appreciation for everybody being here. Chairwoman Johnson came to me and asked me to come up with some possibilities of where we're at, some options for everybody. And so I'm going to go through those options. I'm going to go through pros. I'm going to go through cons of every single one of those options. I'm going to start out with some data that we have. I'll explain where I got that data. A lot of this data is available for the public on public sites, so I would recommend going through some of that. The first thing I think that's been said many times tonight, but I want to say again, is in-person. Our number one goal is in-person learning for all students for 5 days a week. That's where that is what we want to see this year. Looking back, and I think the past experience is really good for us to be able to look at as we move forward here. Looking back at this last year and some of our cases, for this 2021 school year, total student count of COVID positive cases was 1,201. We had staff cases of 3,335, with quarantines for school-based exposures being students 3,309 and staff 111. The typical exposure at a school, elementary school is approximately 7 kids, middle school is approximately 28 kids, and high school is 16 kids. There's more classes in middle school. That's where those numbers come from. School-based exposures that converted to positive in West Ada, we had 29 students that were school-based exposures that converted to positive for a total of a 0.87%. We had 2 staff exposures that converted to positives for a total of 1.8%. Schools in West Ada that transitioned to remote through the 2021 school year, just 1. West Ada confirmed from the mental health standpoint, and I think there's a lot to discuss when it comes to mental health, and I'll cover this in just a second, but West Ada confirmed suicides last year, 0, thankfully. West Ada confirmed suicides in 1920, 1. And I'm going to give you the reason that our mental health counselors that I spoke to, and I'm going to give every credit to our parents out there, that our parents are having conversations with our kids, and we're in touch with the mental health of our kids. This is something that's near and dear to my heart, and so I appreciate everybody in here for making this near and dear to your heart, and I think there's just more awareness around this, so thank you. Important local data points to consider as we discuss this. According to CDH, public data portal, this is available to everybody, 7,019 cases of COVID for students that are for kids that are under the age of 18, which represents approximately 11.8% of all cases. This is all time for COVID. 25 hospitalizations. This is all time in Central District. We need to know Central District covers Elmore County, Boise County, and Ada County. According to Central District Health, data since August 2nd. And the only reason, if you look, I cheated a little bit. I had our district nurse pull this data on August 2nd. So since August 2nd, I have an email from her on August 2nd. That's how I got this data. We had 24 hospitalizations on August 2nd. We started to see a spike in cases, all of those things. That has only resulted in 1 hospitalization and 0 deaths since then. Another piece of information that I think is valuable for everybody to look at when we go through this, the American Academy of Pediatrics Children and COVID-19 report, state level data, which was last updated on 8/23. The first statement out of that report says state level reports are the best publicly available and timely data on child COVID-19 cases in the United States. From that study, 23 states reported, and New York City, I don't know why it was just New York City, but that's how they said it, 0.2% to 1.9% hospitalization. Of the 44 states reporting mortality rates, and New York City, Puerto Rico, and Guam, they reported a 0.00% to a 0.03% of all child COVID-19 cases resulted in death. I put the website on there just so you guys could reference it at some time. Google does amazing things. Summer school data, because I think that's really important. As we look at this, we had students in person, and we had a total of 17 quarantines, which came from 4 positive cases. 0 of those converted to positive. None of the quarantines converted to positive. From our summer athletics programs, which includes students outside and inside. They're in gyms, they are in weight rooms, inside and outside. We had no quarantines. We had 6 positive cases. Current Idaho COVID-19 data, current Idaho hospitalization rate, and this is some of the stuff that Dr. Souza and Dr. Bramwell covered, but percent of beds used, 18.43%. Percent of ICU beds used, 44.28%. This is as of August 21st. I apologize for it being a little bit delayed. Current central health vaccination rate, 12 to 15 years old, 31%, 40% have had at least 1 dose. 16 to 17-year-olds, 42%, with 48% having at least 1 dose. 12-year-olds and above now sits in Ada County at 63%. Oh, I'm sorry, in Central District Health, 63%. I've seen a higher number for Ada County alone. Current Idaho vaccination rates, 12 to 15, sits at 20% as compared to what Central District is. We're substantially higher. 16 to 17-year-olds in Idaho sits at 28%, and 12 years old and above sits at 48%. So when I hear, and I want to make this really clear, we hear about Idaho's low vaccination rate. In Ada County, and specifically Central District Health, ours is not nearly as low as what you're seeing around Idaho. Now let's get into the options. And I would say, Madam Chair, and to the rest of the trustees, these options can be moved around. I came up with options that I felt like are clear for where we're at. I'm going to give pros and cons of every single one of those options, but please remember that they can be moved around. The second thing I'm going to cover, and it came up a little bit in Dr. Souza's comments, is quarantine procedures and what quarantine procedures look like. I think there was, I want to clarify, and I'll get into quarantine procedures in a second, but one of the things that was said is if a child is in a class without a mask and is positive, then the entire class becomes quarantined. That's not a quarantine. Quarantine is 6 feet. We consider a quarantine within 6 feet of somebody for longer than 15 minutes with or without a mask. And so that's the current policy on quarantines. I just want to clarify that. If one kid is, I don't want people to think one kid turns positive and then Mrs. Jones' second period class is gone. That's not how that works. So option one Superintendent makes the decision regarding COVID-19 mitigating measures, which includes but is not limited to mask requirements. This really is where we sit as of this second right now. The pros to this, school communities are addressed at the lowest possible level. We address it school by school. It's easy to make data-based adjustments based on what we're seeing. Targets specific populations as opposed to the entire district. One of the things that in conversations that I've had is it's really difficult to make a decision for Eagle High School that is the same decision for Sienna Elementary School. And that's where a pro comes in on this. Cons, school-to-school requirements would be inconsistent. You may have a child that goes to Eagle Hills Elementary who has to wear a mask for a little while because we have to control the spread, and also but your other student that goes to Eagle High School doesn't have to wear a mask. There could be some inconsistencies there. Students need to adapt. There could be some change in this, and there needs to be some flexibility. It doesn't address the larger community need that Dr. Souza mentioned. Option 2 is a mask requirement is implemented for all or for a limited group of students, staff. And when I say all or for a limited, that would be K6, K8, 712, K12 staff. There's a lot of options there. Pros, it's the same across the district. Depending on the quarantine policy, it could result in potentially fewer quarantines, and it addresses the community impact as mentioned by Dr. Souza. That is not my phone, for the record.
I don't know how to turn it off. So.
My wife is calling to ask me to bring home some milk.
Yeah.
I apologize.
Jennifer.
Okay.
Yeah, I know. That's
Cons to this is, to a mask requirement is, it does not allow for parent choice. It places the burden of enforcement on our school staff. It does not address the specific needs of each school. And it becomes a learning distraction. There's a compliance issue, getting people to comply. And the timing of this is right before we start school. Option 3 is a mask requirement that is implemented for a limited group of students. Could be K6, could be K8, could be 712, could be K12, could be staff. But the parents are given the option to opt out of that mask requirement. The pros, it addresses the community impact. It allows for parent choice. It potentially limits the challenges with policy enforcement. Student-to-student inconsistency, the cons would be student-to-student inconsistency, operational collection of waivers, and timing. And I'll talk a couple things about this. As part of the CDC guidelines and the CDH, which CDH has agreed with, as part of those guidelines, there's always a medical exemption. I'll just tell you my personal struggle with this, and this is really for the board and for our parents to hear. Going through and making a decision on what's a legitimate doctor's note, what it's not, I think is really difficult on our school administrators. And then on the other side, I think there's a socioeconomic place to this, where if you have the money to get to the right doctor that's going to write you a note, you're going to be okay. If you don't have the money for that, you're not going to be okay. That's why I would look at that. That's an advantage of an opt-out, where parents could sign to opt out, and it wouldn't require a doctor's notes. Okay, now we get to go through the fun stuff. Quarantine policy.
Wait.
Yep.
Troy, am I on? Okay. Before we go there, I want to see if so I'm going to ask the board, would you like to pause here, look at the options, and ask some questions first before we go to quarantine, or do you want to hear it all and then ask some questions? Your guys' choice. Oh, Trustee Ozuna?
I have one question that I'd like to ask.
I think if we have some, let's go with it, just because sometimes you forget your question as we go through, so go for it.
Pretty straightforward, but I have a question about what you're thinking with the opt-out? What would that look like?
Yeah, so operationally, we've met on this option, if it becomes an option. And what that would look like is we have a form that we would send out to parents. Parents would come back with a form. We'd have to have their ID just so we knew there was verification. They would sign up and sign a form that said, hey, they would come back to the district. We would have offices set up here. We would have extended hours set up here at the district office so parents could drop that off. We would put that into the indicator into Power Schools so teachers were able to see that, and they'd have that, and they would have that at their disposal. So we would take that. The biggest thing is, just so everybody can hear this, the biggest thing is we want to take that off the backs of our principals on day one.
Thank you. Any other questions? Trustee Buffy.
Thank you, Madam Chair. Question, so on option 3, how does that differ from option 1? So does that mean if school data was at a point where you might implement a mask mandate for just one school, would parents still have the option to opt out of that?
Yeah, so part of that release goes over that. The release is really specific about if there is a breakout in which we need to contain, we need to contain the spread, then there could be a mask mandate for a limited period on that school. So it's the hybrid between the two.
So can I just clarify what I heard?
Yep.
So in option 1 today, in a mask optional situation, if we had an outbreak in a school that required you to put masks required in place, there would be a required compliance at that point for the outbreak or the safety concern. In option 3, parents would have an opt-out form on file, but if we had an outbreak in that classroom or that school and you needed to make it fully required with no opt-out provision, that would still be in place in option 3. So it's in place in both options?
And at that point, we would probably offer to some of our parents the option of, do they want to go to remote for a limited amount of time? If their kids truly don't, I believe that, I mean, my kids are going to really hate me for saying this, but I have 2 kids. I think that's, I think they're a good example of this. I have one kid that'll wear a mask and she's like, hey, fired up, I'll wear a mask. I have one kid that it really bothers emotionally. I'm the only one that knows that because I'm dad. And I have to respect that. And so giving parents that option, I think is really important to me. But at some point, if there is a case in which we need to require that, at a specific school, I think it's really good to be able to say, hey, you can go, we're gonna have to require it for 10 days. You have a choice to go remote for the next 10 days. So it'd be very limited in scope.
Thank you. All right, I'm looking down to make sure there wasn't any other questions before we kept going. So, okay, thanks.
Here we go, quarantines?
Sure, quarantines, oh, sorry. Trustee Klopfenstein.
Thank you very much. Sorry about that. I was just wondering, does especially the options 1 and 3, have you looked at legal for that, and does that violate the trustees' requirements under state law to ensure that pandemics or was it infectious diseases are made under control?
I would say that we would still be. I'm not the attorney here, so I think that's a question we could look at for legal advice, but I would say that we would still, I'm not saying we'd shut our eyes and just say, hey, let's let COVID go by. We would still have mitigating processes in place. We'd still have quarantines, one of those things, washing hands. We'd still have a lot of procedures in place.
Pass it by legal.
Okay.
Yeah.
I think we can absolutely do that, but I would just say option 1 is where we're at today. So, and that's actually, I'm just going to say it now, that's actually my reason for the question, because if we got in a situation where we have to control the infectious disease in a school, we still have to have that ability to do that. That was my question that was the reason for it, was if you were intending that in legal liability. So, but Trustee Kopp saying option 1 is where we're at today, but we still can verify just for the sake of your question, because I don't think we have ever gotten legal authority on it. So. On option 1, even.
Now we're ready to go quarantines?
I don't know. Is everybody ready to go quarantines?
Can we take a 10-minute recess? No.
I know. Quarantine time?
Okay. Quarantine procedures. So current guidance from CDH suggests that both the exposed and the carrier must be wearing a mask to qualify for a quarantine release program. Many districts across Idaho and really across the United States have adapted different systems for this. And you see everything from if you're exposed, you need to wear a mask for the next 10 days, to full quarantines. And so we're getting in when we talk about that, I would love to get to a point where we say, if you're exposed, you need to wear a mask. That could be an opportunity for us to get to. We need to wear a mask in those situations. I'm going to go through what this looks like, because listen, I live the quarantine world, so I'm going to make sure that everybody understands this in the most basic form. As it sits today, this is what it looks like. Scenario number 1, first of all, as I stop here, I promise.
Sorry, I'm going to ask Sherry to come get this phone for Sarah Hatfield so that we can not have it interrupt the meeting anymore. I don't know if Sherry Newbold's in the room or not. Oh, you're right there. Can you hand that to her and have somebody take that and hold it for Ms. Hatfield? Thank you. Sorry.
Okay, and I'm going to pause before I do this, because the unsung hero in this entire room, I'm going to tell you, is sitting behind that computer. Troy, Char, for your entire team. This is a lot to set this up. And they worked the entire day. By the way, we also have other stuff going on district-wide. So please, please, please. Okay, so the scenarios as they sit today. Masked, positive person, and I'm going to call them mask positive, mask exposed. I don't know another way to say that. So mask positive person, mask exposed. If that happens in a classroom as it sits today, 10-day symptom check, they check in, 10-day mandatory masks, but they're able to maintain school and work-related activities if they're asymptomatic. Number 2, Matt.
Derek, sorry, can I interrupt you for a sec? That's our current policy today. Today. And in that policy, is the student able to sit in class as normal, or is there some other?
Yes, maintain normal classroom activities, maintain school work-related activities if they're asymptomatic. That's the exposed person, not the COVID positive person.
That's our 0-day policy, is what that's what
our
we've been
quarantine
called.
release program as it sits today.
Okay.
Mask.
Okay, and then
and athletics. It just came to me that, or I should mention athletics. We have included that as a school activity.
Okay, thank you.
Scenario number 2 is COVID masked COVID positive. Obviously, that person is 10-day quarantine, and I'm going to call that 10-day isolation. The person not wearing a mask, exposed, not wearing a mask, 10-day quarantine, option to test after day 5, return on day 8. I'm going to tell you what really happens in this, just the reality, and this is my own anecdotal data, and Tracy can come yell at me for this in a second. In the school, what really happens is, a lot of times you don't get notified until really late, and so this becomes like a 1 to 2 day quarantine. Is that a fair statement? Because a kid doesn't test until and I'll walk through that timeline. This is what we saw a lot. Okay, a kid doesn't feel good on Friday. He's at school, and then he says, "Oh, you know what? Saturday I'm fine. Sunday I'm fine. Monday goes and tests." So walk me with me on that. Saturday, Sunday, Monday. Now we're 3 days into that. The last day of exposure was Friday, right? And so then we say, oh, okay, test comes back on Tuesday. We're like 6 days in. So that happens more frequently than you would believe. So a lot of times the conversation with parents, and I will just tell you because I made many of those calls, and if parents are listening, they know I made these calls. a lot of times conversation with parents is, hey, listen, your son or daughter is going to be quarantined for the next day. If you get a negative test, they can come back like in 24 hours. So, and that's just the reality of how it works if you go through that timeline. I see it a lot. I'm not saying it can't ever work away from that, but that's what we see a lot. That's scenario number 2. And this is, as it sits right now, this is within this, directly within policy. Scenario number 3, no mask positive, no mask exposed. The exposed person, 10-day quarantine, option to test out after day 5, return on day 8. Vaccinated, exposed, mask or no mask, mandated to wear a mask for 10 days. They do a symptom check. COVID-19 within the last 90 days, if they show that they've had COVID-19, they've tested positive within the last 90 days, no quarantine. The last scenario is a scenario I would advocate for, and I'm going to give some rationale behind this scenario. No mask COVID positive versus a masked exposed student. And my rationale is this, and I'm not going to use names, but I'm going to use a specific story because I think it lends itself to this. We have a student at Derrick Bubb Middle School. There's not really a Derrick Bubb Middle School.
Not yet.
At Derrick Bubb Middle School, who's getting ready for track. Students really excited and can't wait to compete. Student decides, I'm going to wear a mask every day because I cannot afford anything to happen. Student next to the track star at Derrick Bubb Middle School, I just like the sound of that, test positive and had the mask, didn't wear the mask appropriately. The mask was hanging down on the chin. The track star student wasn't able to compete, was on quarantine because the track star student did everything they could to avoid a quarantine and wasn't able to. That's where this becomes a discussion point. That's the only piece that's different from our current guidelines. As you consider this, with that quarantine release program, the why behind it is this. Our surrounding districts and districts around the United States have really moved into different quarantine rules. Some of those different quarantine rules include, if you are exposed, you need to wear a mask. You see those quarantine rules out and about. It limits the quarantines and lets people control. And again, my kids are not going to be happy with me. I would use my own daughter. If she has a big volleyball match on Thursday, I promise you, she's going to want to wear a mask for a couple days because she can't afford that. It also allows us to have a data point where we can directly compare students that are masked and students that are unmasked and their positivity rate after exposure. So it moves us close, it moves the needle closer to say, hey, does this make sense to be able to say, hey, if you're exposed, you have to put a mask on? It moves that needle closer to that. It gives us some specific data that we can address as a board, that I can get to you guys, that we can address as a district, and we can say, hey, this makes sense. So those are the discussion items at hand tonight.
Thank you. I would open it up for questions from trustees. Nothing?
Oh, jeez.
And you guys, I kind of questioned nothing because frankly, none of us have seen this until just now. Like we purposely wanted everybody to see it at the same time. So other than Dr. Bubb, we hadn't seen it. So Trustee Rusty,
Yeah.
Go for it.
Thank you, Madam Chair. Just a follow-up to, I think it was the last slide that you showed that is kind of your recommendation. So if we had an individual that was wearing, we'll take your child as an example, wearing a mask, and the individual that tests positive for COVID is not wearing a mask, then your daughter would do a 10-day symptom check, 10-day wearing of mandatory mask, but maintain at school, maintain with their activities, go to sports. Do the other pieces that you talked about earlier still apply? So in other words, if they're vaccinated,
Yeah.
don't need to do that.
You got vaccinated would fall into that vaccinated
Okay.
category.
And then if they test it out also, they go after 5
Correct.
days, get a test?
Correct.
Okay, so those still stay in here too?
You got it, yes.
Okay, thank you.
Sorry.
Other questions? Trustee Klopfenstein.
Thank you very much. Are these aligned with CDC requirements?
So the quarantine, all of them are aligned except that, all of them are aligned with the exception of the very last scenario, which would be the second to last page in your packet. Everything else is directly in line with CDH guidelines.
So
Trustee
no,
Klopfenstein, go ahead.
just so I would confirm, thank you. So basically, what you're saying is in that scenario, just so I understand, you're basing if they're vaccinated and exposed, mask or no mask, but vaccinated, they would have to wear a mask for 10 days.
Correct.
Gotcha. Okay. Thank you very much. Just want to make sure you understand.
And I'm going to just look at Tracy really quick. Just yell at me if I'm saying this wrong.
Raise your hand and we'll get the flag. Then he could come on over or come to the mic. Trustee Ozuna.
Can you talk a little bit about our ability to track our quarantine numbers and whether you had a mask on or didn't have a mask on and what that looks like, and then our ability to, or your plan to maybe make changes based on what the data shows?
Sure. I mean, I think that's another advantage to this system is we would have kids that are in classrooms, quarantine release program. We'd have them specially coded so we could separate, and that was kind of my last statement. We'd be able to separate masked versus unmasked. So we could really make a decision on, are we seeing data points that are different? Or can we move this towards, if you're exposed, then you need to wear a mask. Does it make sense to do that? We'd have some really specific data points on that.
Trustee Kofelt.
Thank you, Madam Chair. Dr. Bubb, going back to the opt-out option, I know this would be a concern of mine. If a parent signs the form and opts out for their child, would their child ever be asked to verify that they were opted out? How is that? How does the staff in the school be made aware without having to question the child?
Yeah, great question. And the answer to that is really easy. It'd be no. We would put that through Power Schools, and so teachers would have access to that on their computers. Similar to, I mean, we send confidential information like that all the time through our computers. If there's medical alerts, I'm allergic to peanuts. Don't throw peanuts at me. If something like that, then we put those alerts on. It would be very similar to that in that same area.
Madam Chair, follow up?
Go ahead.
Yeah. Dr. Bubb, as it sits right now, as you mentioned, option one, the board gave you authority to make decisions on, do we move the mask, do we not move the mask, back in June. So assuming that nothing changes with that, and what would be your recommendation today for how we would start school in 2 days?
Yeah, I mean, I would start with saying I'm really looking forward to hearing public comment, number one. Number two, at the risk of sounding, I like handling it school by school. I like having the authority to be able to make adjustments school by school, and to be able to do that. If we felt like we really needed to do something, I think, so option one and option three, I think are both very manageable as a district.
Trustee Kofelt.
Thank you, Madam Chair. So option one or three, an option in some form, and then if I understood you correctly, you would move to that alternative quarantine plan that you spoke of last.
With approval, yes.
Okay, thank you.
Any other questions? I have a quick one on the quarantine. in the scenario, and you got me thinking of it when you mentioned your daughter, they can maintain in school and work-related activities. Would the masks be required when they're in athletics?
We do not require them when they're participating. If they were on the sidelines, outside, they're not required.
Okay.
And that's the majority of our sports right now.
Yeah, I was thinking of volleyball in particular. I'm putting you on the spot, but trying to understand when we get the exposure, what the requirement is on the mask. I know, huh?
If I go home and I do not have a daughter at home anymore,
I know.
hopefully you guys give her a nice home.
Yeah, well, I mean, if you want to think about it, that's okay too.
It's something to talk about, absolutely.
Okay, that's fair. And then the other question, and I'm putting you on the spot a little bit, Derek, because I think it helps understand for the board where we need to have more discussion or not, is option 1 and option 3 are very similar. Really, 1 just makes a kind of a level of standard and then allows for parent opt-out. Option 3 makes a level of standard and then allows for parent opt-out. Option 1, we don't necessarily know which parents are opting out and which ones where the kid, maybe parents are asking for the mask to be worn, and we don't know if that's what the parent wants or not. So given those kind of 2 parent impacts, which would you pick if you had to pick one?
Here we go. I would probably go with option 3. I think option 3 gives parents choice and allows them to make decisions for their kids.
Thank you. Is there any other trustee? Yeah, Trustee Ozuna, go ahead.
This isn't a question, but just a comment. I appreciate that that's your recommendation. After hearing from the medical community and taking in everything that we've heard from all of our community members and our parents, medical community, people that believe on both sides of this issue, they're asking for our help. And so if we have kids that don't mind being in their masks, we need kids to wear their masks in school, and we need kids to be vaccinated if you're comfortable with that, because that's going to help us keep our kids in school, which is our main goal, is keeping our kids in school. If you have a child that really can't wear their mask, this will allow you an opportunity to do something different. The more kids we have in masks, the more kids that we have vaccinated, the more likely we are to keep kids in school 5 days a week. So appreciate that recommendation. Thank you.
Thank you. And I would confirm that I agree with what Trustee Ozuna has said. Is there any other questions or comments? You know the law, lady? It's you're okay. You're okay. Let's ask that question, because I think it's a good question. What's the thought on staff in those scenarios?
I think we should just give her the mic. Yeah, I mean, I'll just be really honest. The staff is a difficult one. We believe that a vast majority of our staff have been vaccinated. I also believe, as I'm sitting here wearing a mask in front of you guys today, and I've been on several campuses, I also believe that we have a responsibility to our kids and to our community, make everybody feel like they're safe. And I don't ever want this to make a kid feel unsafe. And so I've chosen amongst myself to wear a mask when I'm out in public, when I see kids, because that's my choice. And what we're saying is we want people to be able to have a choice, and that's my choice.
Thank you all for standing and following the rules. I appreciate it.
And so what I don't want is there to be a divide between our amazing, incredible educator and a student based on this. So I think that's got to be a consideration as well. That's where I go back and forth.
Thank you. I actually have a question along those lines. One of the things that's really, I've really struggled with, even though I fully believe what the medical community is asking us is a very, very important thing for us to think about, because if our number one priority is to keep kids in school learning, we have to consider all of the potential risks. That being said, last year, we were really trying to just get kids in school, right? And in doing so, we probably, in my opinion, went harder on the mask wearing from just an operational standpoint than maybe like kids in some schools. I had parents say couldn't take a mask break. We had kids wearing masks outside. So is there some operational changes we would make even in a required setting to be less stringent and more, I mean, even us, we leave here and we go out and take a break. So just kind of how would we run that operationally? And in that same vein, also make sure that kids who are in situations where parents want a mask and parents who don't, both feel comfortable and safe in their family's choices.
So the answer is yes. If we went down that road, I think it's really important to talk about, do we want to just isolate it? Do we want to just say it's in classrooms? During passing periods, kids can take their masks off. I know in some conversations with medical professionals, they were supportive of that idea. Recess they can take outside. I mean, I think those are all things that we can battle with a little bit and talk about. I think those are important pieces where if we went down that road, how do we get there? As far as the nice thing about option 3 is there's a mask opt-out and it takes it off. One of the things that's a struggle, believe it or not, I was an administrator at a school just a few months ago. Those were the days. And one of the things that we struggled with were trying to enforce that doesn't have his mask. When is he gonna? Did he have his mask on? When did he not? If we have this system in place, it helps that for our administrators as they try to track this.
Thanks. One of the things that I really struggled with this last year was inconsistency in policy application across our schools. So given that, and given what we just talked about in masks, I would just encourage us to think about how we make sure that we consistently apply the breaks, the recess. I mean, we had some schools with kids not wearing masks at recess and some with. So it's a consistent, if we go down this path, consistency in how we handle a mask required situation would be really important. I'm not worried about the opt-out portion. I'm worried about the behavioral portion of it. So
I totally agree with you. And yes.
Is there other questions, comments? All right. I feel like you got off almost too easy.
You guys have a good night. Thank you.
Yeah. All right, we're getting to, and sorry, I've been sitting here, getting to the public comment portion. We're going to pull this back up. So, pick this up. All right. So, all right, for the public comment portion, we have a couple asks. So, first of all, we're going to do this, we're not going to do a pros or cons or anything like that, but we are going to have some prioritization on a couple pieces. So if I have any students in the room, would you please stand if you want to testify, and your names are on this list. Okay, so if I'm not going to call your names, what I'm going to ask you to do is just come over and line up over here because we're going to ask you to go first. The next piece, because we have four folks who represent groups in our community, those folks, we're going to have you hear from the 4 of you next, and then we'll go into the list, and we're just taking them in order of sign up. So that's how we're going. And I'm sorry?
Teachers.
Yeah, we're going to have the union representation for teachers. So so.
You want to speak.
Okay, so we put students and parent groups and teacher groups in the front, and then we're going to take this list in the order that we're in. So it's a sign-up order list. So if you're in the list in the time frame we can get to, then we will get to you. If we can't, we did hear from you as far as where you sit. We also have that on record here on the sign-up sheet. So let's talk a little bit about what we want to, because how this works, and I'm going to go over the ground rules again, just so folks are aware. Look, we have to talk about this. So We need folks to refrain from cheering, booing, clapping, heckling, negativity towards others, threatening of others, no personal attacks. And that means on teachers, on students, on staff, on other parents in the room, on kids, on schools. Personal attacks, we're really not looking to hear that. We're looking to hear opinions on where we're at, right? What we would ask for, though, and I think we're looking for some specific information, and that's, first of all, do you agree with the North Star of keeping kids in school 5 days a week as our #1 priority over everything else? Do you agree with that or not? We want to hear you from you. Second, please tell us your preference for COVID protocols. And then third, that even over, what are you willing to give up in order to hit that North Star is what we're asking for you to let us know tonight. Now, it's your choice on what you want to say, but that would be really helpful information for the board to have as we make our decision. So I want to just talk about kind of the rules of how this works. So the point of the discussion is, the rules are we need you to state your name, tell us how you're associated with West Ada. That can be what school you go to. That can be what school your kids go to. That can be that you're a patron, however that works. We have 2 minutes of public testimony, and we're asking that you honor that 2 minutes. When that clock hits the stop sign, we're asking you to stop, even if you're in mid-sentence, only so that we can get through as many people as possible. We're asking you to keep the comments, the topics at hand, which is the COVID protocols. We're not looking to hear about some things that are not on our agenda tonight. But we would take that feedback any other time. We will have to stop the comments that attack another person in the room, in the administration or on the board, so please don't make me do that. I don't want to have to do that. These rules are the exact same rules that we follow in our legislative process when testifying for the State House, so we've got some models we use this for. And then just so you know, the board cannot respond or ask questions, but your input matters and will be considered as part of our decision and discussion later. So with that, you're gonna have to state your name because I didn't call you off the list. So, and Troy, you'll start the clock, and I'm gonna start the hour-and-a-half, 90-minute timer. So, thank you.
Hi, my name is Caitlin Monzo, and I'm about to start 6th grade, and I would like to share my experience this past year with COVID-19 safety measures in place. At school, we were required to wear masks all day, including during PE and recess outside. One day during PE, while running laps with a mask on, I became nauseous and puked. Due to vomiting being considered a COVID symptom, I was forced to quarantine for 14 days. During this time, I was not able to see a single friend, and I struggled to get my schoolwork done because of limited access to my teacher. Also, during the school year, each and every class was kept separate all year. I could not play with my friends from other classes in my last year of elementary school. When everyone wore masks, it made me feel alone. I was not able to see people's emotions, and it made me feel wrong for having emotions because I didn't know if anyone else had any. Please allow me the choice to free my face and allow everyone else to have that choice too. I'm sporting yellow and sporting a smile, and I hope you will too. Thank you.
Thank you very much. Caitlin? Sorry. Thank you very much. You did a wonderful job, and I know it's not easy to get up in front of this many people. So you guys are just going to have to come on up and let me know your name because I don't have you on the list. So please, and welcome.
Hello, my name is Connor Allen. I actually am on the list over there, just so we're all there. Perfect.
Gotcha.
All right, as I just stated, my name is Connor Allen. I am a senior at Rocky Mountain High School, and I'm here to speak on the same thing that I did barely a few months ago. While vaccines have begun rolling out at a steady pace, Idaho still has the second lowest vaccination rate of any state in this country. And while I myself have been fully vaccinated, and I am still here living and breathing, I know there are a number of students who have not. Some by choice, some due to parental restrictions, and some because the same conditions that make them more vulnerable to COVID-19 prohibit them from doing so. For all these students, I urge we continue wearing masks. Now, last year, we saw a number of exposures within our school. I personally saw more than one in the theater department alone. However, we took the proper precautions, we followed the rules, we continued to wear our masks even when the exposed were quarantined, thus preventing a further outbreak of cases. And for that reason, I urge we continue wearing masks. As I'm sure many of you know, we currently have a Rocky staff member in the hospital due to COVID-related pneumonia. This alone should be enough to let us know that this problem is far from over. And yet we are still here today debating whether or not a problem even exists. To me, that is shocking and confusing. It's for all these reasons that I believe that we should be going to school 5 days a week. However, the only way to do that is if we stick with option 2 and we continue to wear our masks. And I recognize that that was a rather short speech, but thank you for listening.
Thank you. Troy, you might have to leave me hot on here because I don't think you'll catch me on all of these. Thank you very much. The next, welcome.
Thank you very much. My name is Jackson Holmes. I'm a junior at Rocky Mountain High School. It's kind of crazy that this is the second time fighting for student safety by speaking to the board in only 4 months. Despite the growing danger of COVID-19 on students, they continue to support putting the students that they're responsible to protect in danger. Kids younger than 12, the entirety of West Ada's elementary schools, can't yet be vaccinated. That's 19,002 students unable to be vaccinated and unprotected from COVID-19. By putting them in rooms without CDC recommended precautions, we are knowingly and willingly putting them in harm's way. If you think your students were impacted before, I can only begin to imagine the toll of illnesses on themselves, their classmates, or friends. Your actions don't just impact students. Despite vaccinated teachers, the Delta variant can still take a toll on the adults responsible for your students' education. Until we have booster vaccines readily available, you are putting 3,613 incredibly vital teachers and staff members at risk. Students cannot be in school in person every day if nobody is there to teach them. I am prioritizing my safety, my cousin's safety, my sibling's safety, my friend's safety, my teacher's safety, even over going in school for full person and every day for 5 days a week. Though the everyday in person is important to me, it's more important for me to be safe and healthy, as well as my friends and family. And board members, it is important for me to know that it is your responsibility to keep all kids in your care safe. Thank you.
Thank you very much. Next. Welcome.
Thank you. For reference, my name is Dallin Riley. I'm a student at Centennial High School. Ladies and gentlemen of the board, I thank you for the opportunity I have as a student to voice my concerns tonight. I've been a student of the West Ada School District nearly my entire life and have firsthand experienced many of the changes made to improve the quality of education for us kids. I attended Centennial High School last year until I could no longer do so due to certain medical conditions in relation to wearing a mask and having my mask exemption removed. While not halfway through my freshman year in high school, I was forced to leave Centennial and move to the all-online program, Virtual Schoolhouse. This was very hard for me, as I have always been a rather social individual and thrived in team activities. Online was neither fun nor educational, as I rotted away staring at a screen for nearly 8 hours a day. I can appreciate and recognize that online school may be a beneficial choice for some students. I am not here to argue or debate that, but it is an alternative option. Last year was incredibly hard for me and many of my peers. For the short period of time that I was in school with masks on all my peers, I noticed many different occurrences from the lack of emotion and connections made to a lower quality of education and rising mental health issues. I noticed that unlike previous years in school where I was able to create connections with my teachers and peers while working towards a positive learning environment, the requirement of masks made it almost impossible to do so. The friendliness of a smile and the separation by 6 feet severed the many possible relationships and joyful moments that could have been. I received little friendliness last year and few positive learning environments due to my teachers. In specific, my math teacher last year, who has since retired, directly targeted me and discredited me and my medical exemption in and out of the classroom, limiting the amount of water I could drink, calling me out in front of the class, yelling at me, and almost going through with her idea of putting me behind a plastic shower curtain hung up by chains in the corner of a classroom to ensure that I was isolated, all because I couldn't wear a mask. This can all be confirmed by Dr. Bubb, my previous principal. There is no further need to call it the sheer division that masks are causing the students and faculty of the West Ada School
I'm
District.
sorry, we're going to have to stop your testimony. I appreciate your.
Thank you all.
Thank you. So next student, please. Thank you. Sorry, that was my bad. I didn't stop that. That was my bad. I didn't stop that.
Okay, hello everyone. My name is Claire. I'm 17 and I'm going to be a senior at Rocky this Thursday. I hope you've all had a good summer and you're excited for school to start again, as am I. As stated previously, I'm going to be a senior. I've been in the school system for the past 14 years of my life. That's including both preschool and kindergarten. Everything that I've learned has been geared towards how I can be a benefit to society. The main two ways we've been taught to do so is by being courteous and through research. We've been taught for as long as I can remember to check sources, use multiple different sources, and listen to both sides of the story. I've looked at all of the data, checked my sources, and used many different sources, and of course have listened to both sides of the story. I have concluded that I'm not afraid of going to school without a mask. I've been in public education my entire life. Sorry. I know that going every day has its risks, such as active shooters, cold and flu outbreaks, bullying, and many more other circumstances that are outside of my control. I don't fear going to school because of it. I, like most kids my age, want to leave a mark on the world. Fear, however, will hinder us from doing so. I understand why you'd be afraid. These are unprecedented times, but what I don't understand is why you'd push that fear on others. I strive to be a kind, empathetic, and sympathetic person, so why do we have to remove each other's choice to be considered as one? If you want to wear a mask, then by all means wear your mask or multiple masks if that's what makes you feel comfortable. But by no means make it so that those who can't or won't no longer have that choice, as well as vice versa. I would also like to bring to attention the fact that the board has stated that they don't like to make decisions last minute. And since this is last minute, I trust them to keep their promise. Mask wearing for me and many others is extremely difficult. After a full day of mask wearing, I have found that I have extreme headaches, nosebleeds, and fatigues. It's so bad that I'm not able to do my homework or concentrate, causing me to suffer for it at the next day of school. I only ask for you to respect my opinion.
I'm sorry, we're going to have to. Thank you for your time. Thank you. Next student, thank you.
Hi, my name is Julia Loudon, and I'm going to be a senior this year at Mountain View High School. I would like to share my experience as a junior with all this chaos going on and all the restrictions and how it had an impact on me. I have never struggled in school. School has always been super easy for me. Math was my strongest subject, and so it shocked me when I had to find a tutor. I quickly learned that I could not learn online. I also never felt a connection with any of my teachers last year. I felt discouraged to rarely reach out to my teacher based on them appearing unapproachable with a mask covering their face, and their constant reminder that I do not get within 6 feet of them, which then led to doing online work sitting by myself. The stress levels I felt got so bad that therapy and counseling became a common discussion in my household. I'm a very happy person who enjoys life. No matter what chaos it throws at you, well, it wasn't quite working out for me. I had to quit dance, the thing I loved doing, the one thing that kept me motivated. But when you wake up at 5 a.m. every single morning to work so hard for a performance and that competition gets canceled or your family can't even come and watch you, do you know how that feels? The constant letdown of activities, social events, things that teens and children need in order to be happy, being canceled and postponed really started getting to me. I feel like I could never experience that feeling I had 2 years ago. Everyone packed in the bleachers, screaming and cheering as our football team scored a touchdown, or chanting our school anthem at the homecoming assembly when school begins. Did I just lose my high school experience that all you parents and adults rave and hype up about all the time? For what? For a virus that we now know has been detected by a test that failed FDA approval because it provided up to 97% false positives for a virus that affects children less than the flu. Don't let us miss out on another year of school, especially the parts that make school worthwhile. And I beg of you, keep masks optional. Let us make that choice. And on a side note, don't threaten our athletes or the students' grades based on the decision to wear a mask. That is discrimination is unacceptable.
Thank you. Next student, please.
Hi, my name is Natalie Bangham. I'm in fifth
Natalie, will
grade.
you pull that mic down so we can hear you? There you go. Thank you.
Hi, my name is Natalie Bangham. I'm in 5th grade at Siena Elementary. I'm here tonight to let you know how I feel about masks. First, I'm tired of smelling all the bacteria in my mask all day long. Second, my face breaks out. Like I said, those are the least of my problems, but they are problems. My biggest concerns are, in all honesty, I can't breathe well, especially when I went out to play. More than half of the kids don't even wear or use masks correctly and touch them all day long, so they do more harm than good. I couldn't understand what my teacher was saying half of the time, which affected some of my schoolwork. I hear that I am not at high risk of getting sick, so why do I need to wear this mask? Other people's fears should not dictate my life. I just want to feel like a normal kid again. My future depends upon it. Thank you for your time.
Thank you very much, Natalie. Do we have another student over here? Or are you guys? Okay, oh, thank you.
My name is Noah. I go to Meridian High School. I have a medical exemption. Please stop the trend of school segregation in regard to medical and vaccine status.
Thank you very much, Noah. All right, I just want to make sure we got all the students that we had signed up to testify. And then I'm just going to go in the same order on the parent and teacher group that we had before. So, Mr. Benetti, I believe, if you would like to testify. I'm going to just remind, at least the adults, I want to hear the kids tell us whatever you want, and everybody can do that too. It would be really helpful to know, one, do you agree with our North Star of keeping kids in school 5 days a week as a #1 priority? What's your preference on COVID protocols? And you heard the options laid out before us. And then what are your even over priorities? So, thank you.
I mean, as long as it's not against my time, I'll answer the first question first. I like it. It's just a promise you can't keep. And the doctors verified that today. And Derek, if you want a way to have a school named after you, I have an easy solution. But I will start now. My name is David Benetti. I have 2 girls in the district, and I represent the West Ada Parents Association. We're going to hear a lot of statistics tonight, but what should matter most to a school board are these 2. The fact that we have a 5% drop in math and 2% drop in English scores from 2019. This is the educational price that our children paid, not from COVID itself, but from the decisions that we made in response to it. Now, when the pandemic started, this trade-off made sense. We didn't know, so we waited 15 days, and then we waited for a vaccine, and then we waited for the teachers to get the vaccine, and here we are nearly a year and a half later, and we are still waiting for COVID to end so that we can get back to educating our kids, which should be our priority. But it will never end. There will always be a new variant. Kids will get sick. That's what they do. The important question is, will they get seriously ill? Because if the danger is significant, then there isn't a parent in this room that would rely on this to protect them from harm. We would keep them home. That's why this discussion is utterly pointless, and it would be worth the price. But if the danger is minuscule, then we're sacrificing our children's education, social development, emotional growth, their very childhood for nothing. And that's why we need to track safety, not spread, because parents always choose what's safest for their child. That mandate was given to us by an authority way above this board. That's why choice matters. And so I ask the Board of Trustees, in whom we placed our trust, to hold your word. Don't betray us. The students' future starts tonight. Make it something they can smile about.
Thank you. Ms. Evans. Thank you.
The first question that you asked us was if we agree with keeping kids in school as our #1 priority. It is a huge priority, but it definitely affects the community and our ability to access community service. And to begin, we do want children, as I said, to spend 5 days a week, no remote or alternative days Ideally, no isolations or quarantines. We want our children to learn, to socialize with their friends, to participate in schools, and simply enjoy their childhoods. Given the case numbers that we currently have, there's only one prevention strategy that will give us the best chance to come close to making these desires stay a reality: wearing masks. Last school year, West Ada showed over and over again the efficacy of masks, and this year, the state after state have shown what happens when masks are optional. This virus is in the air. Not only will students and their families suffer COVID infections if masks are optional, but they will spread around the community, overburdening the already taxed healthcare systems, and they told us what crisis standards of care can lead to. It will also likely compromise the reliability of utility companies. They are already telling their employees to do everything possible to not catch COVID. Some of these employees are parents of West Ada School District students. They either need to take their child out of the school, or not live with their child, or something other that could be detrimental to the family and the child. West Ada plays a pivotal role in maintaining the integrity of these critical institutions by controlling the spread within its sphere of influence, the schools. Masks are less about protecting the wearer and more about protecting everyone else if the wearer happens to be sick. Thus, an individual's choice about masking affects everyone around them so much more than themselves. We don't allow people to drive around without headlights on at night, or shoot a gun in wild random directions. These behaviors are dangerous to everyone else. Choosing to go maskless in a pandemic is like closing your eyes and flailing your arms in a room full of people.
Thank you.
Thank you.
Mr. Lucas. Actually, Mr. Lucas, we're going to have you go because we didn't, I mean, that's where we're going. If she's on the list, though, we'll definitely hit her if you're in the time frame that we can get to. So thank you.
So I believe the North Star, I think that was your question, is that kids 5 days a week in school with parental choice. I'm going to read this on behalf of my wife. My name is Alexandria Lucas. I have 5 kids in the district. Last year, my daughter Caroline was in kindergarten. She struggled every day with wearing a mask. Not only was it difficult because it caused her to have headaches, and it also inhibited her from learning proper diction. She struggled learning letter sounds and to read and write. My 5th grader, who hasn't been an excellent student to date, has had a significant regression on her English and language arts ISAT scores. I also know kids' scores suffered statewide on the ISAT. As a school board, you are in charge of regulating the education of our children and overseeing a multi-$100 million education budget, not a community health budget, funded by local taxpayers and voters. Why would you make it harder for the children in our community to learn? We know wearing a mask impedes learning. It is harder for kids to learn and also for teachers to teach while wearing a mask. We also know, as we learned last year, that masks are not good for mental health. If you are wanting to make the most successful environment for kids, the best option is masks optional. Dr. Bubb, the superintendent you unanimously chose and put in charge of creating a plan, has created a plan where masks are optional. On behalf of the entire community of parents, teachers, students, and staff, I ask you, why are you considering 2 days before school begins to betray the commitment the superintendent you chose already made? You are not medical professionals. You are in charge of the education of our students. A mask mandate creates a suboptimal environment for learning and a suboptimal environment for mental health. Please stick to what you committed to in June and again 2 weeks ago and keep our masks optional. I'm also tired of hearing that this is a 50-50 issue. You do not know.
Thank you very much.
You did not take a
Thank you very
survey.
much.
Thank you.
Mr. Lucas, Sam Perez, you're up. Thank you.
My name's Sam Perez. I'm the president of the WAEA, representing over 900 teachers and staff. We currently took a survey, and hundreds of participants answered several questions. One was that the majority of them did not agree with the optional mask policy. Secondly, 76% of them responded that they would like to have mandated masks until we get this COVID under control. We don't like wearing them either. I want to go back to teaching students like I used to. I have 27 years of experience of doing that. Last year was the hardest year of my entire education career. Finally, the third option that Dr. Bubb had presented of parents dictating how we teach their kids, masked or not masked, 61% of teachers have indicated that's going to change their workload dramatically. So, some questions that were given to me by teachers who wanted me to ask. Will employee feedback be considered when the school or when Superintendent Dr. Bubb talks about mandating masks in an outbreak in a school, and how do we protect ourselves in our buildings? Will hazard pay be offered to those working in more risky environments such as custodial, cafeteria, ERR, overcrowded portables? What is our district doing for COVID-19 protection, sanitation that is more than last year when masks were required? Principals are saying that the new COVID-19 absence policy starting in October makes employees use their sick days if we are quarantined because we tested positive. Administrators also have said that there will be no shields on desks. And finally, please give us a chance to teach.
Thank you very much, Mr. Perez. Appreciate it. All right, so we're going to get to the list and we're going to just go in sign up order. So and I'm not great with pronouncing some of these names, so I'm just going to apologize now, but Brent Moulton? Yeah, actually, that's a great idea. Thank you. Danny Forbes and Christy Carter. And so maybe if those folks will come over this way, and then Gina Coffin after that.
Madam Chair, Dr. Bubb, trustees, my name is Brent Mouton. I live in Eagle. I have 3 grandsons. One of them just graduated high school at Eagle, another attends high school at Eagle, and a third at Galileo. I am very much in favor of 5-day in-person teaching, but I'm also in favor of liberty and personal freedom. If you choose to wear a mask, by all means, wear a mask. But that doesn't mean that everybody needs to wear a mask. Given that the PCR test is flawed and been replaced or being replaced, given that we have Delta variants and Klingon variants and who knows where it goes from there, and there's no test that even can test that right now. So I don't even understand how that's even relevant. Masks don't protect you. Given that COVID particles are the size of a mosquito and a mask has pores the size of a chain link fence, you can figure it out. At this point, my youngest grandson has RSV, and he has had issues because of the bacterial content in his mask. At this point, I don't believe that it's an issue that the school board needs to be really concerned with. It's more of a medical situation. I actually have found very quickly online, and I have provided this for a few members. I think I have 3 or 4 of them up there. It's a list of 30 studies showing the ineffectiveness of masks. If you're scared, by all means, isolate, stay home, take care of your own business, but don't put that on anybody else. Thank you.
Thank you very much. Danny Forbes. Thank you. I'm going to call that name one more time. Danny Forbes. All right, Christy Carter. Boy, second person to sign up's not here. That actually feels a little unfortunate.
My name is Christy Carter. I have 3 students in the district at Pleasant View Elementary School. I am a former school teacher of 15 years. I taught in Texas, New Mexico, and for the Department of Defense. I'm here to speak to you as a parent for Parents' Choice. My husband and I feel strongly that masking children should be up to the parents. There are 47 studies that confirm the ineffectiveness of masks for COVID, and 32 more confirming the negative health effects on our children. These studies have not been, that is what our counterparts use as words to defame the truth. All of these studies come from reputable universities and medical clinics. They are prestigious. All of them come to the same conclusion, supporting that there is no supporting evidence that masks are effective in protecting us or third parties. In fact, the contrary is true. Masks have serious side effects for children. Face rash, which all of my children had this year. Bacterial infection, which I personally had, a staph infection from a mask, wearing it 4 days to visit my mother, which I had to be on antibiotics for 21 days to get cured. You are concerned for our children's safety. Do you know how many times a child touches their face a day? Put a mask on them, and this number increases exponentially. I watched a staff member at the last board meeting in this very room, and she's here tonight, touch with a mask on, touch her face in an hour and a half, 56 times. The students and the parents around her touched theirs less than 10 in the same room I was counting. I could not believe the hypocrisy of it. Who's spreading more germs? If she's touching her face 56 times, way more germs than someone who's not touching their face without a mask. The virus is 99% survivable with our kids. Not one child has died in the state of Idaho from COVID.
Time. Thank you very much. We have Gina Coffin, and then I'll have Brad Ehrlich, Jenny Vandermeeker, and Dallin.
While children are thankfully less likely to die or require hospitalization than adults, many are still developing long-term symptoms from the virus. Last school year proved that kids could go to school and remain safe, even during a global pandemic. Why was this possible? Masks. Masks worked really well last year, and most children adapted well. And part of the reason masks work well is because all children and staff wore them inside diligently. If we move toward a maskless or mask-optional environment, especially among children under 12, we risk losing that safety measure that so many of us desire and deserve for our children. All it takes is one maskless infected individual to spread the virus to many. Thank you for your time and consideration.
Thank you very much. Brad Ehrlich, Jenny Vandermeeker, and then Dallin Riley, and Ryan Riley after that. Dallin already went. Sorry, he went, right? But then Ryan is up. Okay, thank you.
Thank you very much, and you have a very tough choice in front of you. I don't envy your seats at all. The reason I'm in front of you today is I have two students who go to Eagle High School, and I wanted to talk to you for a moment about the studies. I gave you all a flash drive, or gave the clerk to give you. The doctor earlier said that there were no studies that shows that masks are ineffective, and I've given you now 32 different studies and citations that show that the masks are not effective in spreading COVID-19. The next thing I want to point out is that if we are going to use masks, the blue masks that you're wearing do not help spread COVID at all. An N95 mask is what should be used. So as you think about having COVID positive students or potential outbreaks in the school, if someone you think has been exposed to COVID-19, they need to wear an N95 mask. I was a journalist for a decade. I covered the H1N1 virus, and I do want to tell you that you need to look and search for information. The yellow journalism and the puffery out there is enormous, and that's why I've given you this information. Last thing, mask versus no mask. I'm going to give you some empirical data that only I can give you. I'm the CEO of the largest fitness company, boutique fitness company in the state of Illinois. We have 60 locations. In the city, there are mask mandates. In the suburbs, there are not. We have done 1 million different workouts in a brand name that you would be very familiar with, without any difference in the COVID spread between masked and unmasked. Lastly, 0 children have died from this, and the hospital issues about beds and staffing, that's not our issue. We should not sacrifice this young generation for the old generation. That is biblically wrong. I thank you for your time.
Thank you. Jenny, Ryan Riley, Shannon Kessler, and Josh Jacot, I think.
Hi, I'm Jenny Vandermeulen, and my son is going to be a senior at Eagle High School. And my notes changed so much, and my phone is about to die, so I'm going to kind of hit the points wherever. But first, your question about having kids in school 5 days a week. Of course we do, of course. But I feel like there's a catch to that. You want us all to say that, and then there's going to be, okay, well, you said you want them in 5 days a week. Well, they're going to put a mask on them. And I don't think that's fair. Number two, you choose 2 doctors that, and I don't know who chose them, totally unfair. And they were biased 100%, and you should have one of each speaking tonight. And they were boring. They are not mask experts.
Look, ma'am, we can't personal attack, so please don't personally attack the
I
doctors.
didn't attack, I don't know who picked them.
I'm not asking, that's not please don't attack the doctors is what I asked.
Oh, they're not here.
I know, that doesn't mean we don't.
Oh my gosh,
Yeah.
okay, seriously. Anyway, it's grossly irresponsible for these doctors to assume that there will be bullying or peer pressure of kids who choose to wear masks. It is unjustified to claim that this is a foregone conclusion to speculate that all students will get COVID. The doctor never said how many in the hospital had COVID of the children's hospital. We have an influx of people that have moved here. 1,000 people are moving to Boise. Boise alone, 500 of them per day are going to Meridian. 1,000 per day are moving to the Boise area. So we need more hospitals. So that's pretty much a joke too. I didn't even get to my own notes. Let me see in 16 seconds. Oh, the last thing I'll say is that apparently masks and the vaccination doesn't work because you all did, everyone has a mask or a vaccine, it doesn't work. If you're making us wear a mask,
Thank you
so it
very
doesn't
much.
work.
Thank you. And sorry, I called Shannon Kessler's name, but I see that she signed up not to testify. So we have Ryan Riley, Josh Duquette, Kristen Sapnis, and Don Seeger. So thank you, Mr. Riley.
Hello, I'm Ryan Riley. I'm his dad, who spoke earlier. The only thing I can offer you is my own personal experience. I'm an owner of a company here in Meridian. At the beginning of last year, I was faced with a similar decision you're faced with, is how to deal with COVID and COVID within my company. I remember the day that I stood up in front of my company, I said, we are going to be open. We took our own destiny in our hands. We're going to be open, and I gave my team members a choice. If you want to wear a mask, wear a mask. If you want to work from home, work from home. But I was going to be there, and I was there every day, working. And the reason I share this with you is because last year we thrived as a company. Not only did we grow over 100% of our annual revenues, but we also hired another 100 employees during 2020. So when companies were struggling and shutting their doors not to open again, we thrived because we took our destiny into our own hands. I gave my team members a choice. There was no consequences for working from home. There was no consequences for wearing a mask or not wearing a mask. It was an opportunity for my team members to choose and make their own decisions. And we thrived as a company. The reason I'm sharing this with you is because if you allow the same choice in our educational environment, our children will thrive. They will have the opportunity to not only be educated in an environment, as you heard my son say, that where he can make connections with teachers, where he can have connections with students and other staff members, but they will thrive because they want to be there and they're going to be there to be able to learn and grow in a way that they are supposed to. I appreciate the decision you're faced with. I choose option 3 with choice. Thank you very much for taking the opportunity to hear us.
Thank you very much. Josh? Thank you. And then we have Kristen Sapnis, Don Siegler, and Katie Barnes. And Don, it doesn't say whether or not you want to testify or not, so no? Okay, thank you. Then Angie Labarth would be after Katie Barnes.
Thank you. Madam Chair, Dr. Bubb, trustees, my name's Josh Jaco. I'm a parent of 2 kids in the West Ada District. This is quick and simple. All of the metrics the board and superintendent should consider enacting a mask mandate, local health authority guidance, community spread data, local hospitals filling faster than ever before, point to the district needing a comprehensive mandate for all grade levels. The personal choice argument against masks fails because it ignores the obvious. A real personal choice affects only the person making it. That's not the case with masks. There's zero evidence that masks cause harm, physical or otherwise. Without them, we'll get more quarantines, and as Dr. Bramwell pointed out, that isolation causes emotional harm. I know. I watched it happen to my kids last year in virtual schoolhouse. Perhaps the most important thing I'll say tonight is that a mask mandate with an opt-out is not a mandate. It's useless in the eyes of viral spread. Option 3 is no different than option 1. Let's not pretend otherwise. If the goal is to avoid quarantine, then you need to look no further than unmasked schools in Texas, Florida, Alabama, Mississippi, Louisiana, and 10 other southeastern states. Thousands of students are sick and quarantined there. My even over is to keep kids in school full-time. Masks aren't a perfect answer. I agree with that. I don't like them either. But we're better off with them than without them. Do the right thing. Stand on the right side of history. Mandate masks at every grade level. Thank you.
Thank you. And please, I really would like to just keep this going, and I appreciate keeping the respect at the level we need it to. I know this is emotional. I mean, there are multiple.
Hi, I'm Kristen Sathnis, and I'm a science teacher with the district. Thank you, Dr. Bubb, Chairperson Johnson, and fellow trustees. I don't envy the position you are, given the vitriol, the shouting, the booing. I've seen attempts to discredit teachers and insults to our students who spoke last year, let alone what's happening at board meetings and to teachers nationally. Our vaccination rates in Idaho are embarrassingly low. A new study reported on today from the CDC showed that unvaccinated are 5 times more likely to be infected and 29 times more likely to be hospitalized. 29. Last year, as a community, we helped to flatten the curve, but our situation this year is getting worse and fast. Our curve is a lot steeper now. Please listen to St. Al's, St. Luke's, primary health and public health professionals. They need the district to be in masks, otherwise our hospitals will have to divert more patients and frightfully move us into crisis standards of care. Masking is a responsible action we can take to prevent our healthcare system getting further overwhelmed. Masking protects kids, their families, and the unvaccinated, both young and old. Everyone in this room wants our students in school 5 days a week. Wearing masks is how we can get and stay there. Without masks, students and teachers will have to isolate. Peer pressure at this vulnerable age, even adults, would win out over safety concerns for so many of our students. The kids are resilient. Wearing masks is nowhere near as traumatic as losing a friend, teacher, or family member would be. Please let's not have schools be the point source outbreak. Thank you for all your time and care with our hundreds of emails and calls, and please support us in masking up. Thank you.
Thank you. Katie Barnes, Angie Labarth, and I know I'm messing up the names, Chris Garvin, and Shannon White. So thank you.
Kate Barnes.
Oh, Kate, sorry.
That's okay. Registered nurse and parent of 2 students in the West Ada School District. Masks don't harm kids. There are no reliable, peer-reviewed, replicated data to demonstrate any harm, physical or psychological, caused by masks. We hear emotional internet memes mindlessly parroted to tug at our heartstrings, stories of kids in schools being sad while wearing masks. But the plural of anecdotes is not data. The data we do have show inarguably that masks slow the spread of COVID, and less COVID means more days in school. We all want students in school, in person, 5 days a week to promote learning, engagement, and socialization. The argument over masks is harming kids. Their psychological safety depends on the adults in their lives maintaining a sense of control, even in difficult and stressful situations. That resiliency America so praises develops from having adults who demonstrate a calm and rational approach to life's inevitable hardships. Emotional overreaction based on misinformation that feels right, misplaced anger at healthcare workers and teachers, and perpetuating myths is what is harming our children today. I do not live in fear of a virus. I definitely do not live in fear of a simple mask that I wear every single day at work. I do live in fear of a world where willful ignorance, when shouted loudly and often enough, wins out over the truth.
Thank you.
The truth is, masks protect our children. Thank you.
Thank you very much. Ms. Labarth, thank you. Recognize your name.
Said it perfectly. Angie Labarth. My name is Angie Labarth. I have 2 boys with special needs at Hunter Elementary School. And I'm speaking to you tonight not just as someone whose entire household, including my children, still have the antibodies from our COVID experience over a year ago, but especially as a concerned mom of 2 boys with special needs. Now, last year was rough on all of us, I think we'd agree, but for kids who rely on facial expressions to help them navigate the already very difficult early years of learning social cues, ways to get along with each other, these masks have been stifling to their development, their ability to learn, and to their spirits. Not to mention their masks are disgusting. Have any of you actually looked at an elementary school kid's mask? I've seen them pulled off rearview mirrors, picked off dirty car floors, flung from backpacks, sneezed into, stepped on, and my kid chews on his like it's candy. They're disgusting, and kids and adults, as we've learned, are touching their faces all day long. They lost their usefulness a long time ago if they ever had it to begin with. True, a properly fitted N95 surgical mask works great in sterile environments with proper usage and regular replacement. But those pathetic ragtag, homemade cloth and boxed masks do nothing to protect you from anything. And it even says so on most of the boxes. Not effective in the protection against COVID. Literally says it on the boxes. So it's time to allow us to get back to making our own choices regarding our personal medical devices. Time to focus on our kids' mental health. Time to look at more than just what the mainstream media is shoving down your throat, especially the idea that this is a 50-50 split. BS. Time to get back to using common sense. The vaccine's available to nearly everyone who wants it, and those who are still afraid of a virus that 98% of people will survive can wear their mask. The rest of us want to make our own choice. Please, Dr. Bubb, don't institute another requirement.
Time's up. Thank you very much.
We've had enough.
Chris Garvin.
Thank you very much. I'll go old school with paper. I'm a parent of 2 Rocky Mountain High School students. I also teach at BSU, so I know that education takes a hit when you are wearing a mask. I'm not saying it can't be done, but I'm saying that it's hard to connect with the kids you teach, and it's hard for them to see you, hard for you to check in with them. So there's definitely a downside with it. Starting off, appreciate Dr. Bubb really doing the homework and really showing the numbers that this is a public health crisis. I don't think anyone's really going to argue that, especially here for the medical professionals, but that it largely targets older people. I mean, as far as 0 deaths of kids here in Idaho, and I think the hospitalization rates being in the 0.something% number. As far as kids being vectors for spread, if they're 20% of the population and 10% of the cases, I'll take the medical professionals at their word that that's the facts. They don't seem to be huge spreads for me. So what we've got here is bad outcomes happening to older, like my age, unvaccinated adults is what we're told. So you've got older adults who've made a personal choice, and that's fine. I respect their choice not to get a shot, and they wind up in a hospital. But apparently the kids have to pay the price. Kids who are not at risk hardly at all for the disease, they're paying the price for their education and generally their social life and having to wear the mask. So one issue, public health thing, not an educational thing, and largely focused on adults. I will touch on a couple of things. I'd urge you to relook at the metrics on the plan. I know you have some of the metrics as case count, and I'd urge you to instead maybe look at hospitalizations, and especially hospitalizations of kids. Germany recently did that, I think, yesterday or the day before. And this is OBE, and I appreciate the cost-benefit analysis. I appreciate that you're looking at the cost of wearing a mask, that there is a cost. It's not just a freebie.
Thank you very
when you
much.
look at the benefits. Thank you very much.
All right, we have Shanna White, Brian Lenz, Attila, Siskus, I think is next up. So.
Good evening. My name is Shayna White. I live in Meridian. I've been raising my family in Idaho for 18 years. My husband and I are parents to our 7 children, 5 of whom are currently school age. Our family is very diverse. Some of our children are adopted, some are biological, some are Black, some are white, some have genetic disabilities, while some have mental or learning disabilities. All are unique and they all have unique needs. As their parent, it is my job to know their needs and it's my job to keep my kids safe, and I take that job very seriously. The past year and a half has been difficult for our family. While trying desperately to meet the individual needs of each of our children, we found ourselves with children in public school, charter school, private school, and homeschool. We did the very best that we could, trying to stay on top of each unique situation. We thought we had a handle on things, but how many people in here know kids are really good at hiding things? Last year, Idaho's suicide rate increased a record amount. A tragic 420 people in Idaho lost their lives to suicide. In November, our teenage daughter nearly became one of those statistics as she attempted to end her life. Since then, she has been in and out of a mental hospital. Whether you believe masks work or not, they dehumanize people. They discourage personal connection. They limit communication. How is my daughter, who is struggling emotionally, supposed to have critical, personal connections if she can't even see the other person's face? What about my son, who's nonverbal and relies on facial expressions of others for communication? What about their safety? COVID is simply not dangerous for children, but these other issues absolutely are. As I said earlier, as parents, it is our job to know our children, know their uniqueness, and champion what is best and safest for them. If you feel like covering your child's face is what's best for them, go ahead, but you do not get to tell me what's best for my child. Of my 5 school-age children, I have already permanently removed 2 of them from West Ada. I believe it's possible for my other 3 children to thrive at West Ada, but only if parents' freedom to decide what is best for their children is protected. And to answer your question, I believe we should be in school 5 days with full parent choice.
Thank you. Brian Lenz, Attila Siskus, and then Natalie Bingham or Bangham. Thank you.
Hi, my name is Brian Lenz and I live in Meridian. I am a father of 4 homeschooled kids, so you might wonder why I'm here. I care about the future of our state and our country, and our kids are the future. I'm here for them. Let's talk about indisputable COVID facts. There are over 25 million kids in America, and per the CDC, there have been 3.9 million cases in kids 17 and under. Also per CDC's latest stats from last week, 361 kids have died of COVID in the US since January 2020. Thus, if a school-aged child tests positive for COVID, they have a 0.00009% chance of death. These numbers are roughly comparable to a typical winter month flu season for children, in which on average 150 children die per year. If you never advocated for masks during previous flu seasons, you have 0 moral authority to advocate masks are a necessity for kids due to COVID. Please don't use our kids as political pawns. The numbers do not back up claims that this is about the safety of the kids. If we really care about safety, let's discuss the adverse side effects of masking and social distancing. Socialization is critical for childhood development. Reading facial expressions and seeing smiles on the faces of kids and teachers are both critical parts of the learning process. Masking eliminates these essential nonverbal interactions. Masking conditions our children to constantly live their lives in fear, even fearing their own friends and family. Masking directly adds unnecessary anxiety to our children, which often leads to depression and mental health issues. I will no longer stand silent while this psychological warfare is perpetuated on our children. The most alarming statistic of all can be found in the suicide numbers. Prior to COVID, suicide was already a leading cause of death among kids. The CDC estimates a 51% increase in attempted suicides in 2020 among girls under 17. It's difficult to get exact stats on suicide, but it's evident the suicide numbers dwarf COVID deaths among children. I believe that if you mandate putting masks on our kids, it's child abuse and you are contributing to these mental health problems. Every life has dignity, value, and worth. All of our kids are created in the image and likeness of their creator. Every death, especially among children, is tragic, but facts and statistics matter. I'm calling on you to
Thank you very much for your time. Attila? And am I saying that right?
Absolutely.
Okay, thank you. So unique name.
Folks, good evening. My name is Attila, just like Attila the Hun. I was born in Eastern Europe under a dictator. And I remember as a child experiencing what it was like to have the government dictate how an individual should parent their children. It's a slippery slope, folks. It's a slippery slope that's going to hurt all of us. Let me show you something on this box that you folks were handing out back there for folks that wanted to hand out or wear masks. It stipulates this mask is not a respirator. This mask does not eliminate the risk of contracting any disease or infection. Replace if damaged or soiled with blood or other bodily fluids. Huh. Bodily fluids like, oh, I don't know, saliva? Have you folks seen what happens when a child is exercising, running around, blowing spit out their mouth? I have an 8-year-old son. That young man is a germ machine. I cannot believe the stuff that he gets into on a regular basis. But let me make sure we all understand something here. It's my choice as the parent to dictate how my son lives. My choice. If another parent wants to go ahead and mask their child, they want to vaccinate their child, hell, if they want to put them in diapers until they're 15, I don't really care. But they don't get to dictate how I parent my child. We are not yet a communist country. Our liberty still means something. In fact, when we first started this meeting, we all stood up and pledged allegiance. And let me remind everybody that part of that pledge says liberty for all. That includes our kids. Have a good night.
Thank you very much. So I think Natalie went because it says right here, kid. Okay. So James Lucero, Megan Vigneto, Julia Loudon, Jennifer Loudon, and Laura Pierce. All right, Sue Darden. Then we'd have Jasper Ryan, Connor Allen, and and Wendy Medeiros.
My name is Sue Darden, but I've actually been asked to read a statement for a teacher who couldn't be here. Her name is Carla Morton. She said, to the West Ada Board of Trustees, Dr. Bubb, fellow educators, and fellow patrons, I'm entering my 16th year of teaching, my 11th in West Ada. I teach 5th grade. I'm vaccinated, and I'll be wearing a mask as the year begins. I had truly hoped that we would be able to begin the school year not wearing masks and not being concerned about a rise in COVID cases. Yet, we're debating the issue again. I have several concerns I'd like to attempt to address. The first, the rise in variants, in particular the Delta variant, now is because we have not reached immunity with the vaccines. My hope is with the FDA approval of the Pfizer vaccine, more people will become vaccinated. With the rise in variants affecting children at about the same rate as the original virus, I quote from today's webpage of the American Academy of Pediatrics. As of August 19th, over 4.59 million children have tested positive for COVID-19 since the onset of the pandemic. Over 180,000 cases were added the past week, reaching levels of the previous winter surge of 2021. After declining in early summer, child cases have increased exponentially, with over a 4-fold increase the past month, rising from about 38,000 cases a week ending July 22nd to 180,000 the past week. The age distribution of reported COVID-19 cases was provided on the health department websites of 49 states: New York City, the District of Columbia, Puerto Rico, and Guam. Since the pandemic began, children represented 14.6% of total accumulated cases. For the week ending August 19th, children were 22.4% of reported weekly COVID cases. And she goes on to say that she hopes that you would continue to consider the information and mandate masks for everybody. Thank you.
Thank you very much. I just looked at the time. We're going to have time for about 10 or 12 more. If I call your name and you want to give it up to somebody else behind it, please just let me know. Jasper Ryan, Connor Allen, Wendy Medeiros, Julie Edwards, and Kaylee Doyen are up next. Did I?
Yes, you did.
Who did I skip?
Well, when you said Jennifer Loudon.
Yes. Oh, okay, please. I didn't mean to. I didn't think you were here. Yeah, so let's go back. We'll get Julia Loudon and Jennifer Loudon and Laura Pierce. Okay. Julia went, okay, thank you. Sorry. There's a few things going on here. There's people on the list who don't want to testify, so I'm trying to cross them off, but they're on the list, so sorry. All right, go ahead, sorry. Just state your name for us, please.
Jennifer Loudon.
Thank you.
Hi, my name is Jennifer Loudon, and I'm a mother of 4 children who currently attend West Ada School District, and I am also a registered nurse. I want to take this opportunity to respond to the interview yesterday with Dr. Peterman and a statement that the American Academy of Pediatrics has stated unequivocally that there is no association of masks with any emotional detriment to children. With no disrespect to Dr. Peterman, that statement is baseless. The fact that teen suicide rates increased 5-fold last year shows that children are being affected by these restrictions, including wearing a mask. In the 1950s, Erikson's theory of psychosocial development was introduced and has been continued to be researched for the past 70 years. This theory is so respected and credible that it is currently taught in high schools, colleges, and medical schools. If you look at the stages that involve our school-aged children, you will first find the industry versus inferiority stage, which is ages 6 to 11. In this stage, it is stated that school and social interaction play an important role during this time of a child's life. The next stage includes our 12 to 18-year-old children, is where they explore independence and develop a sense of self. Research has linked a strong sense of identity to better emotional and psychological well-being in adolescence. Friends, social groups, schoolmates, and social trends all play an important role during this stage. According to Erikson, failing to master these critical tasks can result in social and emotional struggles that last a lifetime. They are comparing 1 year of so-called data, which they claim that children are not being affected, to decades of research that clearly states that our children's mental health have been and will continue to be affected if we continue doing what we have been doing. The suicide rates alone prove this to be true. Majority of parents of school-aged children know this to be true. Our kids are struggling mentally and physically. We know what is best for our children. We need the option to choose. If you leave masks optional, you are giving everyone a choice to do what is best for them. Parents can choose to send their kids to school in a mask or without a mask. If a family has...
Sorry, technical difficulty.
Oh, okay.
Oh,
Thank
time
you.
went up. Sorry.
Keep masks optional. Thank you.
Thank you. All right. Thank you, Troy. I'm falling asleep on the job. I shouldn't say it like that. I was focusing on what she was saying and I didn't look at the time.
Say my name and then skipped over, so can I go after her?
What's your name? Oh, yeah, sorry. So when I call the names, if you guys will come up behind, kind of line up, so I know you're, like, just so we can move as fast as possible, because I'm looking for people to be ready right behind them. So, but yes, you can come next after her. Thank you.
Hi, my name is Laura Pierce. I have 2 boys that attend Meridian High School, and I wanted to start by saying that I do agree with the North Star idea, but not, like other people have said, not at the cost of our freedom and liberty. So I do feel like it's a little bit of a catch-22. I think most people in this room want our kids in school 5 days a week. The coronavirus, it's not going away. We need to stop focusing on stopping the virus. We can't. All we can do is learn to live with it and build up our natural immunities. Our children are more likely to fall severely ill or die from influenza than they are from COVID. In the past, you have made no effort to protect our kids from influenza. You haven't talked about wearing masks. You haven't talked about social distancing. You haven't put up plastic partitions to keep kids from being apart from each other. So why are those things options now? Focus should be on educating our children. We need to teach them about good health, exercise, eating healthy, maintaining healthy weights, washing our hands, staying home when they're sick. That's what we should be talking about, not mask wearing and staying away from human contact, which is detrimental to not only their physical, but their mental health. For families that want to mask. But don't punish the majority to comply with the minority. Our children are the least vulnerable and yet the most punished by far. Please allow us to have choice. I personally would choose option 1. I don't think there should be a mask mandate, but option 3 would work for me and my family. My wish is to have the kids 5 days in school, no masks, enjoying their childhood, enjoying their youth, which is what I think we all did. Thank you.
Thank you very much. Megan, we'll have you come up. And just stop me if I've missed somebody, but Jasper Ryan, Connor Allen, Wendy Medeiros, Julie Edwards, and Kaylee Doyne are up after that.
I'm Megan Ugetto. I have 3 boys in the West Ada School District, Heritage Middle School, and Compass. Yesterday, we saw Amy Johnson's speech about how easy it is for us parents to decide what is best for our kids, but it's so hard for you as a school board to have to decide for all of our kids. I saw many comments on the video about how we as parents didn't ask you to make this decision for us. So I came here to address those concerns. This was drawn by an 8th grade Heritage Middle School child last year. She was put into that environment to feel that way. The picture doesn't need words. The school board had created this environment for her, to cover her face, to make her feel like she is nothing, to make her feel inhumane. She was an outgoing, or is an outgoing social kid who loved to learn and be with her teachers and peers. This is one of many who felt this way at the schools. I know of kids in the school district who have attempted suicide, been a part of a cutting ring to deal with this for the safety protocols, and even teens who have been scared to go into bed without their phone in fear of a friend calling them in a crisis so they could be there for them. There are so many reasons why parents across the entire country are standing against forcing our kids to wear these masks. It's not because we are ignorant parents who don't believe COVID exists or simply don't care about others who might catch it. It's because we care. It's because we love our children and we can see that there is a balance needed. There are worse things in life than possibly catching COVID. COVID should be treated like any other illness that came through your schools before. Amy, you had it right in your speech that it is easy for parents to make the best decision for their children, so let us make the decision for our children. That is our job. I'm not sure how the school district decided.
I'm sorry, Ruth, time's up. Thank you. Jasper, then Connor, Allen, Wendy Medeiros, Julie Edwards, and Kaylee Doyne. Oh, did I miss somebody again? I actually have 4 pages, and they were ranked 1, 2, 3, and 4. So I'm just going through them in that order. Thank you.
Sorry, I'm short. Hi, I'm Jasper Ryan. I just graduated from Rocky Mountain High School, and I have a younger sister who's going to be a senior at Rocky Mountain this year. A few months ago, I stood in front of this same Board of Trustees. I spoke to you all, and my opinion has not changed. I don't necessarily have a strong opinion as to whether or not people should or shouldn't wear masks. What I do have a strong opinion about is the experts. We brought 2 doctors up in front of this board. They answered every one of your questions. They gave us in-depth answers. They told us about scenarios that we couldn't have even possibly imagined without them. And yet we are still here doubting what they have said. I am not going to tell you what you should or shouldn't do for our children. I understand that you're in a very different situation than I might have been. But what I cannot possibly comprehend is standing in front of others and claiming that you know more than someone with a PhD in a medical field. What I cannot comprehend is standing in front of a room of people and citing sources that have been debunked over and over again. What I do not understand is laughing when someone announces that they are a doctor or that they are a professional. What I don't understand is laughing if somebody does not agree with you. There's no more time for laughter. There's no more time for smiles. I wanted my childhood back too, but I simply don't get that anymore. I want the future of our kids to continue, but they can't do that until the pandemic is over. If we want to continue having our childhoods, and if we want other people to stay safe and to stay sane, we have to listen to the experts. Mandate masks. Thank you.
Thank you very much. Connor Allen, Wendy Medeiros, and Julie Edwards. Is Connor here? All right, we'll move on to Wendy. Wendy, Julie. Thank you. Kaylee Doyen, Jacob Holmes, and Maureen Kerr are up next. Thank you.
Hi, I'm Julie Edwards, and I have two children, both who attended virtual schoolhouse last year and K-12. Now will be entering Victory, hopefully, middle school. I find it hard to believe that at this stage of the pandemic that folks still don't have the basic understanding of how masks work. We wear masks in an attempt to reduce the amount of germs we spread when we cough, sneeze, yell, sing, laugh, etc. The mask acts as a barrier for respiratory droplets expelled from person A to B and vice versa. While surgical masks offer more protection than cloth masks, either option is better than wearing no mask at all. And while wearing masks won't eliminate all transmission of the COVID virus, it at least eliminates some risk. When worn properly, masks have not been shown to cause any risk to adults or children. I've also heard a lot of, you do what's right for your family and I'll do what's right for mine. I'm trying to do what's best for my family, but it isn't about you or me alone. This is about our community as a whole. How can we work together so our children can spend as many days as possible inside a classroom where they learn best? That's what we all want. We want our kids in school. Wearing masks is a simple rule to follow, just as students are expected to show up on time, turn in their work on time, and follow dress code guidelines. If parents have chosen to not vaccinate their children, that's their choice, just as I've chosen to vaccinate mine, who are eligible. So why can't a mask be where we meet in the middle? And masks don't have to be a forever rule, just a rule for right now. Regardless of vaccination status, I'm asking for all students and faculty to wear masks because there are still households whose children are too young to have the opportunity to vaccinate. There are households who do not want to put their elderly and immunocompromised family members at risk. And let's remember our healthcare workers who have been witnessing the devastation of this virus for 18 plus months already. Our COVID numbers have been increasing.
Thank you. Sorry.
Thanks.
That's it. Time's up. Kaylee, and then Jacob Holmes, Maureen Kerr, and Randy Baltic, I believe.
Dr. Bubb, trustees, my name is Kaylee Doyon, and this year I will potentially have 3 children enrolled at Eagle Hills Elementary. And to be clear, my #1 priority is retaining the right to make my children's medical decisions. Last spring, we asked you to do away with the mask mandate for the last 2 weeks of school. You told us that you couldn't because you had made a promise to parents, and parents had made decisions based on that promise. This summer, you made a new promise when you told me that this school year masks would be optional. I made decisions based on that promise. I forfeited my spot in homeschool co-ops and bridge programs. I haven't bought a single piece of curriculum or supplies for my household. And I even gave up my first grader spot at a local charter school who is in fact standing by their promise to keep masks optional. I did this because I believed that you would stand by your word just as you did in the spring. If you mandate masks without a way for me to opt out, I will be calling my school to unenroll my children tomorrow morning. This time I'll be doing it with less than 48 hours before they were set to be on campus for their first day of school. I'll be unprepared and ill-equipped, and my kids will be who suffers. They've picked out their first day of school outfits. Their lunch boxes are literally already on my countertop. Today they met their teachers, and they've practiced their bike ride to and from school. Don't break your promise to me. Don't break your promise to my kids. They're counting on you.
Thank you. Jacob Holmes. All right, Maureen Kerr, Randy Baltic, Lynn Woodward, and Michelle Freshwater.
Good evening. Thank you for the chance to speak to you guys. I'm a grandmother of 5 grandchildren. Of those 5, 3 of them are in the West Ada County School District. I'm a nurse of 30 years. In those 30 years, I've worked around, I don't know, maybe over 1,000 different viruses. COVID has been the least deadly virus that we have had in this country. But again, I want to ask the question, the PCR test doesn't work. FDA said it doesn't work. They're removing it from the market. What are we testing for? What do we have? Can you tell me? So in order to mandate masks, social distancing, quarantine, you have to give the people an informed consent. None of you, including the 2 doctors there, can do that. Want to know why? They didn't supply any studies on the masks, no studies on social distancing, and no studies on quarantining people with no signs and symptoms. You don't quarantine people with no signs and symptoms, and there is no asymptomatic spread of COVID. None. So, I can give you, I don't know, 400 studies on masks on how ill they make everyone, that you hold all the bacteria and all the viruses in your mask for you to breathe down your throat, not to mention CO2, which damages brain cells and permanently damages your lungs. We're doing that to our children. We're doing that to our children. Shame on us. Shame.
Thank you. Randy? And then Lynn Woodward and Michelle Freshwater.
Hi, my name is Randy. My son is going into 5th grade at Desert Sage. I read a statement yesterday from Dr. David Peterman, the CEO of Primary Health Medical Group. I quote, "There's no association of masks with any emotional detriment to children, and there's no evidence, not credible evidence, that masks in any way are harmful to our children." Last year, my 9-year-old 4th grader would cry and complain before and after school. He had to wear them all day, even at recess. He would say he's not comfortable, he feels ill, he can't breathe, he has headaches, and it's hot. This felt like torture to make my child feel like this. After speaking to his teacher and principal, I made the choice to enroll him in online strictly. At first, this was okay. My son, like most 9-year-olds, very active, social. He was missing the connection with all of his teachers and his classmates. PE and music just isn't the same behind a computer screen. Over the next few weeks, turning into months, he fell behind. Online school just isn't an option for us. So you're telling me a mask mandate is not harmful? The evidence, or in Dr. Peterman's words, non-credible evidence that masks don't cause emotional distress is right here in front of you. I am the mother of my child, and I am responsible to make the best decisions that will impact his life. That's why I'm asking you, West Ada, please let us parents decide what's best for our children and our future leaders. Thank you.
Thank you. Lynn? And then
Yes,
Michelle.
my name is Lynn Woodard. I teach at Meridian Middle School, and I'm glad that we finally got to hear from a teacher on this side of things. I'm also a mom of 4, and even though I've worked over 60 hours in the last week, I stayed here because I think it's really important to keep the teacher and family choice that you've told us that you would have. I'm not against masks. I'm pro-choice. If you think it's no big deal or just unpleasant to wear a mask every day, you're coming from a place of privilege. A lot of us face huge daily issues that aren't just inconvenient. I'm in the same boat with this mom over here of 7 who had suicide issues last year. You don't know that because you don't know the private stories of the kids that are being affected by COVID policies. You can't understand what's best for a child you haven't met. Parents know their kids. We as staff have access to a highly effective vaccine, which makes hospitalization from COVID less common than being struck by lightning. We need to focus our discussion on the kids because our district is responsible for the well-being of kids, not responsible for how many adults outside of our district are in the hospital. You can get doctors to speak on both sides of that issue and leave decisions about that to the politicians. I also want to say that reading emails and listening to comments doesn't give you a full picture of what the district staff thinks. Most of us don't want to risk our jobs saying what we think, but this week at district trainings, volunteering at registration and staff meetings, I've seen at the very most 5 to 10% of people wearing masks. You have hired intelligent people who know our own medical needs, can think for ourselves, and who care deeply about kids in our community. Looking at faces as you walk around the district this week tells you what you need to know about what the staff thinks. As a mom and a teacher, I'm begging you to put the decision in the hands of the people who know the benefits and risk best, the teachers and families themselves, and keep it there. We need continuity. Stakeholders in this district knew the COVID policy and have made their choices for this school year accordingly. People are doubting that our district is focused on learning when you keep bringing this up every meeting. Thank you.
Michelle Freshwater. Thank you. And then Guillermo. I'm not even going to attempt that last name. I hope that somebody will just let us know. Bruno O'Neill, or Brianna O'Neill, and Katie Kindle are after that.
I am Michelle Freshwater, and I'm here as a physician and a parent to 2 West Ada students who are too young to be vaccinated. And I'm dismayed that we are even considering in-person learning without masks in place. My North Star is your North Star. It's keeping kids in school 5 days a week. We've been offered the unacceptable option of keeping our children at home because other families are not wanting to mask. My children did attend the virtual schoolhouse last year to protect them, other family members, my patients, and my livelihood. We also made that decision because we knew there were families who could not keep their children home, who needed those in-person seats. But my children also deserve the benefits that in-person instruction confers. For that to happen safely, masks need to be worn by everyone in school. For those of you who say you shouldn't have to wear a mask, do you also think you have the freedom to drive while intoxicated? If someone wants to stay home and drink in the privacy of their own home, they are free to do so. But once that person gets behind the wheel, they have now endangered others. And that is why we have laws against that behavior. Your freedom ends where mine begins. Similarly, when my children and I wear masks, it's only partial protection for us, the equivalent of us wearing our seatbelts and having airbags. When others also mask, it significantly reduces the risk that this virus will spread, like stopping the intoxicated person before they get in the car. Masks are a fundamental safety measure, many of which we already have in place. We have rules about adequate clothing for our school children. We have school rules about allergens that protect those among us who have severe allergies. And we don't allow children to bring loaded guns to school.
Thank you very much. I'm sorry, time's up. Thank you. Guillermo, you got to say the last name just because I want to know how to say it.
It's really easy. It's phonetic. So Troncoso. I know it's tricky. It looks like there's more than there is. My name is Guillermo Ernesto Troncoso. Most people know me as Will. I will be speaking to the possible imposition of a mask mandate for children on school property. I'm a father of 2, one of whom will be starting kindergarten this week. I would like to start by defining an important word that I believe too many of our policymakers have forgotten: prudence. Prudence is the quality of acting or showing care and thought for the future. Our children are a living representation of our future. My son and I are autistic. This has its pluses and minuses. One of the benefits is that mathematics and engineering come easily to me. I have a degree in engineering, and I've been thriving my career in the field of civil engineering. I work in a lab performing tests and calculations and then analyzing the data. This would classify me as a scientist, which brings me to the second word that I would like to define today: science. Science is a word that is thrown around by so-called experts very often these days. I have to say to them, you keep using that word. I do not think it means what you think it means. Science is a system of knowledge covering general truths or the operation of general laws, especially as obtained and tested through the scientific method. Science has the same derivation as the word knowledge, but science is also the process through which we develop that knowledge. So if I may provide you with some knowledge that you should have, but may not already have. The CDC published a comparative study performed on 90,000 individuals in schools to determine if face masks had an effect on the transmission of the Wu flu. The study showed that no statistical difference in transmission, whether face masks were worn or not. So now that we have seen that there is no clear benefits to the mask of our children, I'll move on to the negatives, an equally important topic which allows me to circle back to the first word I defined: prudence. What are some of the long-term negative effects of masking children? As I mentioned before, my son is autistic. This means that there are certain deficiencies in our development at certain stages, such as speech. One of the most important things in the development of speech of autistic children is the ability to see and articulate, and the articulation of the mouth when making certain sounds, as well as hearing the clear pronunciation of the word. How is my son supposed to hear and see his teacher's mouth when she's covered by a mask.
Thank you, I'm sorry. Thank you. Brianna O'Neill and Katie Kindle, and then we'll have one last one, and that's Jason Harmon, and that'll get us to an hour and a half.
Good evening. My name is Brianna O'Neill, and I am the mother of 3. I am not here to present any scientific facts or data because, as we can all see, you guys don't understand that. I'm here more to speak to the parents. We are all here to protect our kids. What we need to really understand is that this is not about masks, it's about funding. Can you guys commit to walking when they say put a mask on your kid? I will walk. I will stand shoulder to shoulder with all of you.
Brianna, I'm going to ask you to address the board, and please keep us, we got to follow the rules, please. Thank you.
Yes, ma'am. And show them, these people, who pays their salaries. Our tax dollars go to your salaries. They are our children, and we get to decide what we do with our children, not you. This is enough. You do not get to control what I do with my child. Masks are disgusting. They're dirty. I will give you one fact. Have you ever been into a restroom with your mask on? The microbial content, the bacteria, and the fecal matter that floats around is on your face. Congratulations, you are wearing a diaper on your face. So, as I stand here before you, I ask you to do what is right. And that is to make it optional. Because these are our liberties, our freedoms, and you have no right to take that away from us. You are employed because of us. We are your boss. Do what's right.
Thank you. I would just state for the record that all trustees are volunteers and not paid. Thank you. Katie Kindle is up next. Thank you.
Oh dear. I have 3 children in West Ada. Last year, the district debate team came armed to a school board meeting waving empty yearbooks and a heavy dose of pathos. Parents and community members came with science and facts. Truth and logic were ignored in favor of emotion, fear, and warped statistics. I recently heard a teacher compare a child coming to school without a mask as murder. We just heard similar sentiments this evening. Unfortunately, I believe this is indicative of how many in the mask camp feel. This type of reasoning is shameful, inaccurate, and frankly selfish. Never mind that the number of children who have infected a teacher with COVID causing their death is 0 worldwide, or that the number of mortalities from COVID in the state of Idaho in children under 18 years old is also 0. Perhaps these teachers should consider that every time they drive to work, the possibility of them murdering one of our children is much greater. In fact, it is the 3rd leading cause of death among children. It seems that adults are pointing the finger at children, claiming that they need to be protecting the adults. It should be the other way around. These mandates and policies that muzzle our children, distance them from their peers, and place them in front of a screen for a significant portion of their day has caused depression, anxiety, and suicide attempts to go up 5-fold. We just heard comparisons of local COVID cases while comparing that to local suicides. What about comparing COVID deaths among West Ada students compared to attempted suicides? We need honest advocates for our children, not the CDC, who is funded by Pfizer, Johnson & Johnson, and the Bill and Linda Gates Foundation. Our children are the reason you are here. They are the reason West Ada School District operates. You need them, and they need you. What they don't need are odds stacked against them because of carefully selected so-called experts who have no real expertise in epidemiology, but just want to ride their 15 minutes of fame on the virus bandwagon. Please put our children first.
Thank you. And then Jason Harmon. Thank you. And then that will close out, this will close out our public comment portion after Mr. Harmon. Thank you.
All right. Thank you very much. I had a whole bunch of statistics written up, stayed up real late last night to do them, but everybody else has already said them. So I'm basically just gonna, go over a couple of things here. September 1st to February 1st of this year, there were 1,173 deaths for COVID. And that was very sad and tragic. From the next 6 months until July, there were 413 deaths. That's also very tragic, but it was much less. I personally believe in vaccines. I believe they work. I was standing in the back. I know a lot of people here might not agree with me on that. I know that they might say it's a seasonal thing. I get that. But what I do know is I'm not going to try to force any vaccine into their arms, and they're not going to hit a vaccine out of my hand. They're not going to force of themselves on me. And that's how this is supposed to work. One of the things that I kept hearing over again that really frustrated me was people saying that these masks on these children weren't a big deal. That doesn't make any sense to me. That doesn't make any sense at all. This is what I did, right? Forcing our children to shoulder the responsibility and burden of this virus that they are the least risk of, but you require the most of them individually. And the argument that wearing a mask is a minor inconvenience is ridiculous. You're forcing them to do that, but also to stay away from each other, to eat alone at their desks, to live in fear of a virus that doesn't hurt them or the vast majority of people around them. This is no minor inconvenience. I'm running out of time. I want to know one thing. When you guys sent out that survey at the beginning of the year last year, why don't you just ask the parents what we think on this?
Thank you. All right, I wrote a question over here for Dr. Bubb. Do we need a break? And I think the answer is yes. So we're going to take, right now it's 10:10 essentially. So we'll be back at 10:20. Thank you.
Thank you, Madam Chair.
Yes, please.
Good?
No reconvention.
Okay.
Negative.
Thank you. We're going to get the meeting back and going here. I wanted to clarify a couple things for folks, just so you know. We did ask Dr. Souza and Dr. Bramwell to come talk to us about our hospital capacity. They're, besides St. Al's and West Valley, they're the only other individuals that can come talk to us. We also asked Dr. Ryan Cole to come, and he did not respond to come tonight. So we were not able to have him. Well, it wasn't yours, it was his. I saw him all night, so I'm not going to blame you. No, I'm just kidding. And we're not blaming anybody, so just wanted to give that information. So the next part of this agenda is really for the board to have a discussion. And I want to set the stage, and I'm sorry technology is failing me a little bit because I don't use it all the time and the password then comes back up. But I wanted to set the stage for the board real quick. First of all, I thought Dr. Bubb did a nice job of laying out for us options, and as he said, there's variability in those options even. I also want to clarify something because we both heard and got emails on the promises that were made in June. We went back and listened to the entire board meeting and looked for if there was any language that we used that would make it said the word promise, and we could not find anything. So I wanted to make sure folks understood that we actually did go back and look to see if we had used that language. So the piece of, and be happy, I think I just said it, I'd be happy to, if you find it in the board meeting and we missed it, we'd be happy to hear that. The one thing that we have tonight before us is whether or not we want to change where we were at in June or not. That's the first question for the board. And then the second question is, if we do want to change, what do we want to change to? So I wanted to open up first for the board for discussion, and then we can go from there for some motions. So we have the COVID protocols up in front of us for discussion first. So. Trustee Rusty.
Thank you, Madam Chair. I am in support of a mask optional approach as we go forward. And I know option 1 and option 2 do that. But I definitely, option 1 and option 3. And I said this, I kind of touched on it with the doctors, but we're a school board and we're not a medical board. Our federal, our state, our local healthcare agencies have not mandated masks. They have recommended. And when something is recommended, as Dr. Bubb pointed out in his presentation today, a statement made from the Academy of Pediatrics, that the best data to use is your local data. Our local data tells us that this is not something that is adversely impacting our students. But what we do know is it is having academic impacts with some of the things that we've had to do. I think it was Dr. Bramwell today said that there's been a 4-time increase in the number of depression and anxiety cases that they're having admitted. He opined on the fact that he thought it was related to the isolation, but there's really no data for that, so it could be related to the mask. But, my final thought on this as I wrap it up is they both alluded to the fact that putting our kids in masks are not going to fix this problem. The recommendation was to put them in the mask so that we don't infect the adults who aren't vaccinated. And I don't see that as our responsibility as a school board to impose things on our children so that we can make things better for adults. And so that's why for me, I will only be supporting an option that makes mask optional. And I would even propose to my colleagues that we don't take any action this evening, that we leave it where it was, that the superintendent can make the decision. And I think he indicated to us that he would utilize option 3 with the adjustment to the quarantine policy. And I would definitely support that. So thank you.
Thank you. Other trustees?
Madam Chair.
Trustee Ozuna.
Thank you. First I want to say I appreciate the volume of feedback that I've received. I feel your passion, your frustration, some desperation, but most of all, I can tell how much you love your kids. No matter what side you fall on this, we're all advocating for what's best for our kids. For our staff members, I'm really sorry we're entering another COVID year, and I want you to know right up front how much I appreciate the work that you do for our students. I agree with those that think that this decision should be made by a public health agency at the state or the national level, and that hasn't happened, so here we are. Our medical community is asking for our help. I do believe that as a community we need to work together. I support a plan that will result in increased vaccinations and the use of masks in our schools. I believe that this is the best choice for keeping our schools, or our students in school 5 days a week. One of the things that I heard in the testimony tonight, even for people that are advocating for choice, is how difficult remote learning is. We all want our kids to be in school. We want our kids to have interactions. We've got to make decisions that'll keep our kids in school. That said, I know that wearing a mask is very difficult for some of our students. And I do think that we need to have some options for these kids. So I would support a plan that has an opt-out. I would hope that if your child is okay with a mask, that your choice will be to let them wear a mask because the medical community is asking for our help. I would hope that that enters into our decision. We all know our children, which child can handle a mask and which child can't. So I would ask us to think about what we heard from the medical community. I would ask us to think about the numbers in our community. I would ask us all to continue to watch that and make decisions, if you can, for your child, that will help us keep our kids in school. The other thing that I want to share, so it's really important if we allow choice, and if we have kids in different decisions in the classroom, or teachers in different decisions, I'm not sure where we'll land on that, but if we come to that, we need to make sure that our kids are being kind to each other. Tonight in the testimony, I watched some eye rolling, I heard some comments from adults in this room when somebody was speaking that had a differing opinion of you. We've got to do better than that. We expect our kids to do better than that. We need to do better. That's all I have to say. Thanks, Madam Chair.
Thank you. Trustee Buffy.
Thank you, Madam Chair. I agree with Trustee Azuno. I was really comfortable with the mask optional approach in June. Felt really good about it. And then, of course, things have changed. But I feel like parent choice is appropriate for those parents that have also had the choice for vaccine for their child. And even if they didn't vaccinate their child, they had the choice. So I'm comfortable. I feel like choice goes both ways. So I would not be supportive of mask optional for K-6 at this time until the community spread numbers go down, until parents that want to have their children vaccinated have that option that they, and so those numbers, I'm not saying that it has to be, there needs to be a mask mandate until there's a vaccine available. I'm just saying that right now the numbers are high, and I think that we need to be at a lower level.
Thank you. Trustee Klopfenstein.
Thank you very much. So when I voted in June, rates were 2.6, I believe it was, for positivity rates. And it was always my understanding, you know, I have been in this, as we all have actually, since March of 2020. And following CDC guidance, following, you know, CDH, getting their support, AAP, it's been very helpful and appropriate. It's allowed us to get through this. When I decided to vote yes in June, it was not with the belief that we would never mask again. It was the belief that CDC said we could unmask. So it was following guidance is why I voted yes. Otherwise, if I would have known we never would be masked or would be this much of an impediment to mask again, yes, I would have voted no, absolutely. I mean, 5% is what the medical community is believing that we should adhere to. That's our break point, and I kind of would like to follow that. I think the mask optional, we've kind of seen how that plays out a little bit last week. Was hoping to see staff have some, you know, at least a greater percentage to kind of incentivize kids to want a mask and feel comfortable if they wanted to wear a mask. It wasn't there. And it was a little bit frustrating that, you know, parents, yes, more of their choice, obviously, especially going for a reception, but to see staff not mask, it just created a very uncomfortable situation for me. To see that is the option, it really means that the option is not these choices that we're looking at. The option is black and white. The option is we don't mask, and that's what it is, or we do mask, and that's what it is. There is no, you know, series of other issues or other choices. I do want to say that, you know, I think our goal is really one thing, which is to keep schools open 5 days a week with in-person staff. And I do believe the problem with that, the problem facing that is the Delta variant. And I think the crystal ball that we have is looking really at other school districts that have been open. And so Meridian School District, for one thing, that I've been looking at, they've gone from the beginning of July, they started with 100 students getting sick, and that represented 1,200. Now, just when I looked at it recently, it was 1,700 students who've been under quarantine or been sick. Mississippi, they've only been open for 2 weeks. 6,000 students infected, just over 25,000 students in quarantine, 5 student deaths. In our area, we have hospitals that are rationing care. We just had the Caldwell School District choose to at least mask for some of their buildings. There's a local Christian school that's decided to do the same. So we're seeing the trend of infection already coming, and it just feels like we adhere to the guidance and try to slow that down, or we don't and just let it happen. So my personal preference is that we would adhere to CDC, AAP, the guidance we've been given, the guidance we've been staying with this long, and we choose to mask our students. Thank you.
Thank you. You guys, again, please, keep doing the hands standing. That's all good, but we got to keep the decorum in the room. Look, we can make this online, and then, but I think it's important to all be together. So if it's not, we can do that. But I wanted to, I guess I'll share my thoughts. So. I always feel like Trustee Ozuna says some of this stuff better than I will, but I want to acknowledge some things because I've I have friends that sit on both sides of this issue. You know, I have friends who masks are traumatic for their family. They have family members who've had some very personal experiences that cause them, it's trauma. We also have family members and friends whose families have serious health risks. And they're scared to death. And some of those friends have parents who are seriously ill as well, and they're worried about their parents being infected by their own kids. These are both personal situations, and we heard a lot of them tonight. You know, I heard from folks, and I'm going to acknowledge it again, that we heard no promises were made, but we've heard expressed that it felt implied. And we have some kids who right now don't have access to a vaccine yet. And then we have some families who are concerned that the vaccine's not safe. So where I'm at is last year, we were really just trying to get kids in school. That was the goal, and we got that done. This year, we're trying to keep kids in school. It was really easy to know the right thing to do last year to get kids in school. It's much harder to know the right thing to do to predict if and when this virus is going to strike a classroom, a school, or an entire district. And that's what I'm looking at from a trustee position, is when and how do we make sure when it strikes, we're ready, prepared, and we keep our kids safe when that happens. There's so much variation in information. I'm frustrated, overwhelmed, and completely just appalled at the variation in information. I mean, we heard it tonight. We have half the room saying one thing and half the room saying another, and everybody's quoting their facts. So you guys, please, regardless, whether it's 20, 50, 70, we're all looking at different facts, and I think that's something we can all agree to. So we have a year's worth of experience now in data in West Ada that I think we should use. We had roughly a total of 1,500 cases between staff and students last year. We have a Delta variant that is 3 times more contagious. So that's 4,500 cases we could potentially predict for this year. And that 1,500 cases was with masks on at that time. We have an Idaho hospitalization rate of kids of 0.0035. So what does that all equate to? That's 16 West Ada kids that will potentially end up in the hospital if things remain the same as they are today. I don't personally feel good about any of our kids ending up in the hospital. And we've learned and created processes for managing this, but it still requires for all of us to have some degree of flexibility and know that nothing is permanent. We acknowledge that we can relax on some things, but we also need to keep other things going. So some things we have relaxed on, and I think I would like to see us keep going. Definitely no more masks outside. I'd like to see us be more nurturing around choices on masks. And I'd like to see us be less, I don't want to say strict, because I think we need to employ parent choice in this, but I do think that we need to be less, I want to say we want compliance, but we want it in a very nurturing way. I'm still I'm going to go with Dr. Souza's even over. So number one for me is kids in school learning, full-time, 5 days a week. Even over masks required, even over masks optional. It's kids in school 5 days a week learning. I do think when we need to, masks will have to be required if it's necessary to keep kids in school. So with that, right now, there's a couple reasons why I would support option 3. One is that option 1 doesn't let us know where parents actually stand. So I can't tell right now how many parents want their kids masks and how many parents don't. And a teacher can't tell that either. And I know folks have said, we'll do a survey. Well, guess what? Only 11,000 parents responded at the most to any of our surveys. We have 80,000 parents in this district, which means we don't actually know where everybody stands, but option 3 allows us to have that. So option 3 allows us to have exactly where parents stand. I also support the updated quarantine. idea, and I do for two reasons. One, I think it's important to incentivize people to do the right thing. I am frustrated as heck that we're at a point where our local and state leaders aren't giving any guidance to the community. That is their responsibility, and it is the community's responsibility to keep adults out of the hospitals. It's not just on the backs of kids, and I am frustrated that we are at this point where we are being asked, and our poor medical professionals are begging school boards because people won't make the right choices at the public health level to give good public health advice. But in that vein, I want to incentivize kids and staff and parents for us to do the right thing, and I don't want to take it out on kids when they choose to wear a mask for them not to be able to participate in their school activities. And so I would support also the quarantine changes that allows that incentivization. And there's one other reason I would. It gives us some good data points for when a mask is on in quarantine and when a mask is off. So anyway, which we don't have data today on. So for that, I would support option 3 with the quarantine changes. So I do think there is one thing to think about here. We've got variation in our board, and I don't think that's fair, even though I personally trust Dr. Bubb to make a good decision. I don't think it's fair to leave him with that because he needs some good guidance from us in that situation. So I do think, given now that we've heard where everybody's at, it would be not, and I want to make it very, very clear, this isn't to, every member of this board has said at some point to me and in this room that we trust Dr. Bubb, we trust him to do the right thing, we support him. We voted unanimously to put him in this spot. We're not changing that. I think some folks in the press have said, is that what's happening? That's not. But if we're varied, it's going to be very hard for him to operate without us giving some clear guidance. And so for that, I think we do need to have a motion on an option. And then the other piece of this is if we're going to do quarantine guidance outside of public health recommendations, we also need to vote on that as a board. That's not a decision we've given Dr. Bubb the authority in our policies today to make. So with that, I'll leave it open for more discussion, or we can move into the motion section. You know what, I'm going to take it just because I'm curious. Yep. Yeah, you know, you bring up a really good point and something I had in the notes that I didn't say, but all right, we're going to go into motions. I appreciate your question, but I think that's it, right? If the community is all going to come together in it, I don't think our kids should be punished for it. So I'm going to open it up to the motions section since we didn't have any other, you know what, actually, because I wanted this to be a 6-person discussion and you've been really quiet, do you want to say anything before we go into the motion section?
I think I said enough with proposals, so I'm going to sit back and drink my Propel.
Okay. Lucky I just have plain water over here.
Madam Chair, I have one question before we move to motions, if I can sneak one in. Dr. Bubb, how often will you be looking at the numbers and then making changes if necessary as we go along?
I think it's really important to let us get into school, and we recognize that, and I think it was said a little bit, the kids are in the community right now. We don't know what they're going to come in, how that's going to look. We know that whatever numbers they come in with in that first week are not going to be representative of what's going on in schools. So I think we work really closely with within the district, and we'll be looking at our numbers every single day. As far as making an immediate reaction to those numbers, I think we need to take that slowly. I will keep the board updated weekly on where we're at with our numbers, and we'll work closely on that.
Thank you. And then, so I think I actually kind of worked through some questions for the board as you're thinking about a motion. And just for everybody in the room, the chair does not and cannot make a motion. So unless I hand over the chair and somebody else takes that over. So some of the questions that we would have if we make a motion is who can change that board action? Are we going to give the superintendent the ability to adjust even after the board action to go to full required in situations where that's needed at a school and classroom? Are we going to keep that in place? If so, are there sideboards on when the adjustments happen? So for example, Caldwell has a 10%, if the board has any sideboards they want to put on there. How long is the action effective? Is it indefinite or is it time certain? Are there any exemptions to masks required that the board would like to include besides a parent opt-out? Is there things for vaccines? So these are just questions to think as you work through a motion. And then what's the overall enforcement expectations, if those are going to change at all? Inside only, mask breaks, what about non-compliance? If there's anything that the board wants to, not necessarily has to, put in a motion. Those are just some questions that I think it's good to have clarity on in a motion so that people know what they're voting on. I think that if there's more, I'd be happy to entertain. I was just trying to think about what you might get asked when you put a motion in place.
Madam Chair.
Clerk Newbold.
Is my microphone. Do you mind having the motion maker write the motion so that we make sure that this is 100% right? And I will also take notes.
Yeah, I think what we did, Clerk Newbold has asked for a couple staff members to help us. So I think Mr. Heller here.
Okay, I just want to make sure we get it.
And Marcus is prepared to write out the motion so that it can get put up on the screen and then the trustee can verify.
Thank you so much.
Yeah, no problem. And it is a board member's choice to make the motion in multiple settings. So if we wanted to take options first and quarantine second, that's an option. It's also okay to do it all in one. So just up to the board member making the motion.
Madam Chair?
Go for it, Trustee Kofelt.
Yeah, I'll make a motion, but I'm going to do what you just talked about. I'm going to make the motion on the masking option, and in a separate motion, we'll deal with the quarantine piece. So I move that we adopt option 3 that allows for parents to opt out. With that option, I'll just leave it at that. Option 3 with the opt-out option.
Thank you. Would you like an option 3 is K through 12?
K through 12, yes.
Thank you. Is there a second?
I will second.
Thank you. It's been moved by Trustee Kofelt and seconded by Trustee Ozuna that we adopt option 3, a mask requirement that is implemented for K through 12 for students and staff, and that parents are given an option to opt out. Is there any discussion? Right. Seeing none, all those in favor, please say aye.
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 Chair votes aye. All those opposed, please say nay. Motion passes 3-2. All right, you guys, please, we need to keep working here. So the next portion is the quarantine piece, and I would open it up for motions from any trustee.
Madam Chair?
Trustee Kofelt. I was just looking to make sure nobody
okay,
was on the mic. So.
But before I make this motion, I'd like to make one quick comment. I respect each of my colleagues that are up here, and I'm saying this because I understand that there's some split votes here tonight. I respect the passion that each of these trustees and this staff bring every day to every discussion I've been involved in. And I respect the fact that we may come down a little differently on some issues. And I say that because I want everybody out here to appreciate that every one of these trustees and these staff members, at least from my short experience that I've been here, truly want what is best for these kids, like all of you do. We just sometimes we'll have a different perspective. So I just wanted to say that because I understand we have some split votes and it's emotional, but every person up here like you cares. So I'll leave it at that. Madam Chair, I'll make a motion that we approve an alternate quarantine policy, and that we go with the policy of a person that is exposed but wearing a mask, maintains their school and work-related activities, which relates to all sports, and that they would just do a 10-day symptom check, and they would be required to wear a mask for 10 days at school, and they would have the option of showing, like they do now, proof of vaccination, which would preempt that quarantine period, or at 5-day mark, demonstrate a negative test.
Thank you.
And I know that's a mouthful,
Yeah, we're going to have to clarify that one.
Yeah.
So I'm going to give those guys just a second to write that down. I think, and these scenarios were, I don't know how to refer to them, but I think what you're talking to, Rusty, is the scenarios where we provide, if a person is wearing a mask or if they're vaccinated, that they can quarantine by wearing a mask in school. And if you're not wearing a mask, we will continue to quarantine at home or have the testing.
Yes.
So, thank you. We'll let some language get put on the screen before we do that. Before we get a second, because I think the second's going to want to see it. I'm sorry, guys, we can't take any questions from the audience.
Madam Chair, can I ask a question about the motion?
Well, let's get it on the screen first, and then we can, and then if we get a second, we can go through some questions. But let's make sure the motion maker has it up there the way they want it.
See.
I think we're a little off there still. I think you want the policy that a person who is exposed but wearing a mask and or vaccinated maintains their school and work activities that pertain to all sports. It would be required they symptom check, wear a mask for 10 days. And I think we're struggling with that piece. Can you guys?
Tracy, what was that? Classrooms.
Okay. So we need to change after a person who is exposed, add the words in a classroom setting. But wearing a mask or vaccinated. So I think we need to add the words after mask or vaccinated. Yeah, we're going to take it out from down there because it's saying the person wearing the mask also has to be vaccinated the way it's written today. Maintains their school and work activities that pertain to all sports.
Yes.
It would be required they symptom check, wear a mask for 10 days. You can take out and show proof of vaccination, and or show proof of vaccination, or a 5-day mark that demonstrates a negative test. And is that 5-day mark correct, Tracy, the way that's written? Based on the recommendation. The proposal, Trustee Kofelt, is that if you're unmasked and exposed, you would quarantine under normal rules, which is 10 days at home or with the 5-day negative test, correct? Well, maybe you can clarify the recommendation.
Okay, the motion, and I want to get the wording right here, was to go with the option that Dr. Bubb discussed. So would you mind recapping?
Sure, I went with two, I really discussed two possibilities. First possibility would be what we've seen other districts do, and they go, If you are unmasked and you are exposed, we ask you to put a mask on for 10 days if you're asymptomatic. Option 2, which is a step in that direction, depending on what the comfort of the board, option 2 would be if you are exposed while being masked, then you would have you would not be quarantined. You would have ability to participate in activities. So one is no mask. We ask you to. You've been exposed. We ask you to put a mask on for a time period. That's one possibility. Another possibility is you are wearing a mask. The other party is not wearing a mask. You get exposed, then you have access to a quarantine release program.
In your presentation prior to the first part of your scenario, an individual that was unmasked, exposed, they put a mask on for the 10-day quarantine period, but they remain at school as long as they're symptom-free and allowed to participate in activities?
I'm so sorry.
No,
say,
that's
say
right.
that all over again to me.
Yeah. My wife tells me I have a lot of words, so I may be using too many.
And I'm trying to think exposed, quarantined. Go ahead.
Okay.
One more time.
So the first scenario that you described just now was an individual that is exposed and unmasked.
Correct.
They would be allowed to remain at school as
Yes.
long as they're symptom-free and they mask up for the 10-day period.
Correct.
Okay. They would be allowed to continue in activities as long as they remain symptom-free.
Correct.
Okay. Then the other part of that was an individual that was exposed and is masked. They continue to participate in all activities, but for that 10-day period as long as they're symptom-free.
Correct.
Okay. All right.
And are both recommended by you?
Yes, I think both would be, it's really up to the board as far as what support we have. One option, the first option allows kids to stay in class. It limits our quarantines, all of those pieces. Option number 2 does that same thing. It just does it for a smaller population of kids.
Give me a second. I'll try to write this.
Rusty, maybe you can just, if they'll highlight it up, why don't you just adjust the language to what you are trying to make your motion for?
Okay.
I'm sorry, you guys, we're not going to take questions, okay? That all piece will be part of the operational piece that Dr. Bubb will have to define in operations.
Sherry, could we include in this, because this motion does not include the individual that is unmasked and exposed? Okay.
Okay.
Center something that I think.
Okay, thank you.
Yeah. This takes a second.
I appreciate the large, bold print. Yes, I like that. I'd like to ask that we remove the alternate, though, and I would just put, I move that we approve the quarantine policy. because it would just be making a new quarantine policy.
You guys, please, thank you. Listen, at this point, it's really board conversation. Appreciate keeping that, so thank you. So is that?
I think we're missing the symptom check for the bottom section. Maybe we could just take a break and write something out.
If that's the only thing, just add that language.
The 5-day symptom check, that's in our quarantine policy now. So I'm not looking to remove that. So if you have a vaccine, that's in there. If you choose to take a COVID test at your 5-day mark, which that's in there, demonstrates a negative test. Those are both things that are in our quarantine policy now. So I'm not looking to remove those, and I believe they're both in there.
What is the intended difference between
let's
someone
see
exposed with a mask and not with a mask?
So just from a protocols order, we have to do a motion and a second, and then we can ask questions on it. So if the motion maker believes the language represents what you want it to represent, then I'll call for a second. I'm looking for your confirmation on that.
I'm going to read through it real quick one more time. Clean up the wording where the comma and it says, or a 5-day mark that demonstrates. I would just say, or a negative test at the 5-day mark. The 5-day mark. There you go. Thank you. Okay.
All right, we have a motion before us. Is there a second?
Madam Chair, I'm going to second so we can have discussion because I'm not sure that I'm 100% clear on this, but I would like to second so we can discuss it.
Thank you. It's been moved by Trustee Kofelt that we have the motion before us, and the wording's on the screen, and then seconded by Trustee Buffy. So we'll open it up for discussion.
Madam Chair, I was just curious, and maybe Trustee Kofelt can help me understand. So if a student is exposed in the classroom setting, but not wearing a mask, and would that also mean not vaccinated as well? Be required to wear a mask for a 10-day period? Are we considering vaccination in that?
So you're saying if they were unmasked and exposed and unvaccinated, would they still be able to remain in school and just wear a mask and be checked for symptoms free? Yes, that's my intent.
I can say, I just don't think this really represents a quarantine policy at all. You're not really quarantining anyone. We're leaving that exposed child in the group. I think it's, to me, unsafe, but.
My rationale behind it is, and Dr. Bubb, correct me if I'm wrong, how many conversions did we have?
I can pull that up. That's one of the data points. I think it was 0.87%. Yeah, we had 29 total last year out of all of our cases, which represented 0.87%.
Yeah.
I'm sorry, but it's going to ask you guys to go through the chair. So just continue to that. I know we're all tired, and I actually forgot about it too. But I just started to get to a point where we might talk over each other. So I think you answered Trustee Kloppenstein's question, and Trustee Kofelt confirmed his intent. Trustee Kloppenstein, did you have any other comments, questions? I don't want to stop you. You had the floor.
Thank you very much. I truly appreciate that. Again, you are absolutely my friend. I truly appreciate you. Seriously, you're an awesome guy. For me, though, I just don't see if we have basically an unmasked classroom. That's what we basically decided on. And if we're now trying to figure out what the quarantine policy is, and we're not pulling kids out of that environment who would be testing positive or would be positive, we're basically going to leave that positive person in there. I think basically what we're doing is not really quarantining at that point, we're basically leaving them in there. And we have masks, yes, but again, masks are not intended to protect them, it's intended to protect other people. It's potentially, I don't know, it's just risky to me. So that's not what I would see, again, going back to the guidance, going back to AAP, CDC, I just don't see there be something that would fall in the guidance.
Madam Chair?
Trustee Kofelt.
Just for clarification, and perhaps this was left out of the motion, but my intent was the individual that tested positive for COVID would be quarantined at home. They would not remain in the classroom. They would be quarantined at home. And the individuals that were exposed, even if they were opting out of mask, would be required for that 10-day period in the classroom to wear mask and have symptom checks.
So do you believe the language reads the way you want it to? Because the other thing we have is this is recorded, right? So we go back to the clarification of what you said and the intent when you made the motion. So if the language reads the way you intended it to, then the motion is good. If there's language that Trustee Kloppenstein is confused on, I think we can have some questions around what language needs. We have to get to specifics here, though, so we know what's confusing and what's not. So that's where I would leave it. Is if you believe the language works the way you intended, then it's the motion on the floor.
With the follow-up question from Trustee Kloppenstein, what is left out of this is, and I recognize it now, is what do we do with the individual that tested positive? That's not in here. That says that individual has to quarantine at home.
Okay.
So with that being said, I would need to amend this motion and add that language.
Okay. Actually, so the way the parliamentary procedure works is we can have that. We can have that amendment and second it, and then we would vote on the amendment first, and then we would vote on the motion in those orders. So,
or we could just let it die. Would you just like to let the motion die and
or you can withdraw and redo the motion. That's the other way to do it.
Okay, I will withdraw my motion. Don't delete that language. But I will withdraw my motion. It's kind of bad when you make the motion and you're confusing yourself. Okay, so
maybe a suggestion is to add some just language at the end that says any person that tests positives will be quarantined for the 10-day period.
that's where I was thinking of putting it in right there.
We're not going to critique your spelling, Troy. We trust you. And we know.
Troy, the only part that would add in there is the person who tests positive will quarantine for 10 days at home.
Thank you. That's good to add. Get you what you, that's good. Okay, is there a second?
Madam Chair, I will second for discussion.
Thank you. It's been moved by Trustee Kofelt and seconded by Trustee Ozuna for the motion that's on the screen. It's open for discussion.
Madam Chair?
Yes.
Can I just clarify with Trustee Kofelt? Is it your intention with that motion that the only difference between someone that is exposed wearing a mask or vaccinated and someone that is exposed that's not wearing a mask, an unvaccinated non-mask wearer, that the only difference between those two situations is that somebody that's in a mask or vaccinated has the ability to test after 5 days? That's the only difference that I see here with those two. Is that the intention?
No, my intention was that either one could test after the 5 days. Does it not read that way to you?
So is the intention that they're identical? Anybody that
Yes.
gets exposed, this is the quarantine policy?
Might be the easiest language.
What's that?
That might be the easiest language. You don't need to identify masked or unmasked or vaccinated. Just anybody exposed is quarantine, is following that first part of the rules.
Yeah, you're right. That's probably why you're the chair.
Hey, you know what? Sausage making is never fun to watch. So it's okay.
I should let somebody else make the motion.
It's also normal, Rusty. It's very normal. You
Yeah.
ever watch the legislature, you know it goes this way too. So, or Congress, so.
Okay, Madam.
So you can withdraw and redo again if you want.
While we're,
But do you want to have some more questions before you withdraw?
Sure.
Because
Yeah,
that
let's
might
do
help
that.
you too.
That way I can withdraw it a second time and not a third.
while we're in discussion.
Yes.
Would you consider giving Dr. Bub the ability to make changes to this if the numbers indicate that need with the quarantine?
Yeah, absolutely. And Trustee Ozuna, I was actually going to make a third motion when this was done, dealing with giving that authority to make adjustments to this, but we can loop it in here too in the...
I'm only comfortable with this idea if we can respond quickly if the data shows that we need to.
Thank you. Is there other questions or comments? I have one. I am not at a point yet where I can support no quarantines for anybody that's been exposed. I do think masking and vaccinations. So the data that was said here, in that data around how many tests, how many cases went to a positive, was 100% masks all year and hybrid learning for a very large portion of our student population last year. So it is what I would consider the lowest point we have. The other thing was it is very hard to track that information. And we changed our test counting last year during a portion of the year to not just positive cases. You had to be a positive case that you got in school. So we changed the data reporting. So because we felt the community cases were causing too high of a count and actually causing some problems in our data. So I'm comfortable with moving to a policy where we incentivize vaccinations or mask wearing first. If we see that we're still not seeing the movement at that point, then I'm maybe more comfortable moving to the next, but I'd like to move it in slower steps versus going from 0 to 60 all at once. So that's where I stand on this current motion.
Madam Chair, so if I understand correctly, then, so you're saying the part you're uncomfortable with in this motion is that if somebody is unmasked and not vaccinated, that uncomfortable with them remaining at school, they would need to quarantine at home. That's the part you're uncomfortable with.
Yep.
Okay.
Yep. So I liken to Dr. Bub's scenario where his daughter doesn't want to miss her sporting event. She's going to put that mask on. So. Is there any other discussion?
I just want to say I agree with the chairman. I think that would be a wise change.
I'll leave this motion the way it is.
Any other discussion? All right, seeing none, we'll call for a vote. All those in favor, please say aye.
Aye.
All those opposed, please say nay. Nay. Motion dies 1-4. We can still have quarantine policy up for options of motions if we want to change it.
I will make another motion.
Appreciate your willingness to do so.
Yeah.
Motion is in order.
But the motion just left.
You want to change the language out?
I'm going to keep everything there, except I will, because we need to move this forward in some manner, and I'm willing to make a change here if we can get this through.
Troy, can you put the language back up just so? Oh, okay.
That's all right. I can read it. So where it says students who are exposed in the classroom setting but not wearing a mask would be required to wear a mask for a 10-day period. And here we go. So let's change that piece, and let's say students who are exposed in the classroom setting but not wearing a mask would be required to quarantine at home for a 10-day period.
So, I think that's a very valid question. I think Dr. Bubb made the proposal to us, and we would ask that whatever the board adopts, or if a board member wants to ask that question, be happy to entertain it once we get a motion actually on the floor. Or Dr. Bubb can answer that question in the communication that goes out clarifying how this will work from an operational standpoint. So I'll look at those kind of 3 different options for how to get that question answered. That's just the decorum of a business meeting. So, and we've got to maintain that. That's just part of that's just how it works. So, so why don't you
continue with that. Okay, so students who are, I'm just reading it out loud here. So students who are exposed in the class but not wearing a mask would be required to quarantine at home for a 10-day period or produce a negative COVID test at the 5-day mark.
You don't need that last sentence.
Yeah, that's the part I don't want to duplicate what's already.
You can strike.
That's already there. You can just
strike. Yeah.
Really, the only adjustment is wearing a mask, maintain their school-related activities. It could be deleted at the end of that.
I don't want to duplicate.
Yeah. So Rusty, you can strike the whole last sentence.
Be required to.
That's already part of the policy.
Reduce the produce a negative COVID test.
From that last sentence, I think can.
Okay.
I'm not obviously making.
No, I'm all ears for how we can clean this up so it makes sense.
Students who are exposed in the classroom setting, that whole thing can be gone.
Because that's already part of our policy. So
you're correct. Yep. Yeah, that is part of our policy already. That's the way we're doing it now. Yeah. Okay, the last sentence, Troy, can we remove that? That starts with students who.
I also believe testing positive means you quarantine at home is part of our policy as well. But
yeah, who does it say that?
We have that up at the front. The person who tests positive.
Yeah.
Yep.
We're really approving changes.
Yep. So if you wanted to adjust to just the changes, what we're changing, we would move that we change our quarantine policy so that the person that is exposed in a classroom setting but wearing a mask and or vaccinated, and then the finished language. So it's just adjust our quarantine policy.
Should have eaten that cookie.
And then Troy, I think you have to take out the person who tests positive will quarantine for 10 days because that's already part of our policy as well too. So we're going to leave it as the motion is the motion as it stands. The motion maker can make it however he wants. So.
Yeah, no problem. I'm trying to remember, do we, This motion isn't live yet, right? There's no second. We're working through the language of the first.
Yep.
Right?
Yep. I think you just need to remove, I think you can remove everything after change our quarantine policy. Remove to reflect that person who tests positive. So remove all the language about testing positive. That's part of our policy. And then just go change our policy so that a person that is exposed, so that a person or a student, but a person's probably good because it's a staff member too. Does that get you where you wanted, Rusty?
I would add in there, because it's a piece I completely let lapse, is an individual that's already tested positive for COVID. That's already in our policy? Okay, then good. I'm just wanting to make the point to what it isn't in there. Yeah, okay. That's already in there. Okay, so I'll move that we change our quarantine policy so that a person that is exposed in the classroom setting but wearing a mask and/or vaccinated maintains their school and work-related activities. Students would be required to complete a 10-day symptom check and mandatory mask requirement for 10 days or a negative test at the 5-day mark.
Is there a second?
Second for discussion.
Thank you. So you guys, please, we just got to get this done tonight. So, all right, is there any discussion on this motion?
I want to ask one question,
Go ahead, Trustee Ozuna.
This matches the guidance that we're getting from CDH for vaccinated individuals. Is that correct?
For vaccinated, yes.
Okay, so
That's already part of
the
policy.
only
This is
addition
just-
here is that we would put somebody that had a mask in the same situation.
Correct.
Okay, thank you.
Is there any other questions or discussion? This is a motion I can support. Is there any other questions or discussion from the board? All right, seeing none, we'll vote. All those in favor, please say aye.
Aye.
Aye. Motion carries 5-0. Thank you. We have.
Do you want to clarify for these people? This stuff is already in there.
Yeah.
They're asking about.
I'm exhausted.
It's already in there.
Yeah.
What about the vaccinated kid? It's already in there.
Dr. Bub, why don't you clarify?
I'm hearing questions about, what about the kid that's already vaccinated? That's already in the policy. What about the kid that's already had COVID? It's already in the policy. Just listen. It's already in the policy. All we did is amend it for that one situation. We're adopting CDH's guidelines with the amendment of, if one kid is wearing a mask and the other kid is not, and they are exposed, that is what was adopted.
Thank you. All right. So, Trustee Kofel, I'm going to open it up, but you alluded to the fact you had a third motion around Dr. Bubb's authority. So I would leave it, I'll open it up for any additional motions. You decided I can't make one, so it's all up to you or the other three. So.
I'm a little gun shy now. I'll make a motion that we give the authority to the superintendent to make changes to this on individual basis as needed. And that's, let me think how I can clean that up.
You want to?
Yeah, the point I'm trying to get at here is that the superintendent can make adjustments at the individual school level as needed. But
So the authority is already in place today for Dr. Bubb to make that adjustment. We didn't remove it from our language. We modified how we're starting the year. So I believe as long as we don't take that language out, we've still given some direction on how we start the year, and he still has that authority in our policy today.
Perfect. I thought you had said at the beginning that you wanted maybe us to give some
I just want to know
guidance.
if you wanted to adjust it.
Oh,
You didn't
okay.
have to.
I'm good.
Yeah.
Take the mic away.
I have one other question, though, around the boards, and I think this is also just maybe a comment from you can help clarify where we're at. I really have some reservations and think we struck a good balance right now based on our community data, but if we got back to a spot we were at in June, I would feel totally different. So I'd like to see us, even though I hesitate to have regular updates around COVID on a board education agenda, I think we have to have something, and I would ask that you put that in the superintendent's report for us, for at least for the next, and we just watch it at 2-week cycles. I don't know if we need a motion or if you're just okay and comfortable doing that. So,
Madam Chair, yeah, I absolutely am comfortable doing that. Yes.
yeah, I just don't want anything to feel permanent because I think things change on us so much, and I want that to be very clear. So with that, I'd like to see if the board would be willing to delay item 2 on the actions to a next regularly scheduled meeting is what I would recommend, which is September 13th, I think. That's the 7th, that's a special meeting. So I'm not right the 2-week time. So that's what I'd recommend, and I think we need a motion to do that. Do we need a motion to do that, Sherry, or can we just say we'll move it to that meeting?
I need a motion since it's an
Okay.
action item. Thank you.
So we would have to make a motion to delay item 2 to the next regularly scheduled meeting, if everybody's comfortable with doing that.
Madam Chair, I'll make a motion that
Trustee
we delay
Go
that we
ahead.
delay item 2 to the next regular scheduled meeting.
Thank you. Is there a second?
Second.
Thank you. It's been moved and seconded that we delay action item 2 until the next regularly scheduled meeting. Is there any discussion? Seeing none, all those in favor, please say aye.
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 Aye. Motion carries 5-0. With that, appreciate you guys staying as late as you have. Appreciate your time, and would look for a motion to adjourn.
So moved.
Is there a second?
I'll second.
Thank you. It's been moved and seconded that we adjourn. It's a non-debatable motion. All those in favor, please say aye.
Aye.
Aye. Motion
I apologize for
motion
that
carries
painful
5-0. Thank you.